Before we start, I would request all the panelists to please keep their mics on mute. We are live now on YouTube, and we will start the inaugural session in 1 minute. I would request all the resource persons on the inaugural session to please switch on their videos. All the resource persons on the inaugural session to please switch on their videos.
Hi, Geeta. Lovely to see you.
Hi, Asha.
Priyanka, should we start? Priyanka,
yes, sir. We are now live on YouTube, and we are recording this session with the permission of all the resource persons on the inaugural session. I'll now commence the proceedings. Good morning and warm greetings. Welcome to the virtual seminar on women's work in Delhi, Dimensions, Challenges and Emerging Issues. I am Priyanka Tyagi, Senior Manager in Program Administration and Communication with Institute for Human Development. This two-day virtual seminar is being organized by Institute of Social Studies Trust, ISST, and Institute for Human Development. The theme of gender and work, a very pertinent topic in present times, and of course, has always been a very important topic, is one of the core research areas on which both IHT and ISST engage in. The program of the virtual seminar, as you may have seen, is indeed a formidable one. In the course of 2 days, well-known scholars, senior policy makers, members of the civil society organizations, and thematic experts will deliberate on the barriers to women's economic empowerment and offer suggestions to address these barriers, leading to engendering existing policies and formulation of new ones with special reference to Delhi. Before we formally commence the proceedings of this seminar, I would like to thank all the attendees, all the participants, and all the registrants to this seminar. We have got an overwhelming response. Close to 700 people have registered for this seminar. However, we are constrained to accommodate only 500. We are going live on YouTube. Please, if you do not get space here, you are welcome to move on to YouTube. You can engage with us through the Q&A box. I request you through the Q&A box only, and on YouTube through the chat box. You are welcome to place questions. As I said, I'm reiterating through the Q&A box. Now I invite Dr. Janvi Andharia, Director and Research Fellow, Institute of Social Studies Trust, the seminar director, to formally commence the proceedings of this seminar with her welcome and introductory remarks.
Thank you very much, Priyanka. A very good morning to all who have joined us from India and elsewhere for this virtual seminar on women's work in Delhi, Dimensions, Challenges and Emerging Issues. On behalf of Institute of Human Development and Institute of Social Studies Trust, it's absolutely my pleasure to welcome each and every one of you. A special and a very warm welcome to Geeta Sen, to Dr. Geeta Sen, who would be delivering the keynote address. Both the organizations have a very special relationship with her, and we are absolutely delighted to have her to kickstart the seminar with her inspiring address. This seminar is really an outcome of collaboration between IHD and ISST. And in this day and age, as you know, we've for some decades now gone into a lot of specialization. So everybody is into, specializing into very often siloed ways of looking at reality. At one level, it is required that you need to go into greater and deeper depths and nuances to uncover the details of a phenomena. But sometimes it gets so siloed, and therefore a collaboration of this kind is absolutely essential, which enables us to build bridges across different domains, and really for us to learn from one another and to create greater impact. And gender equality, as we now know, is no longer a specialized domain. And it's recognized as a goal in itself, but also as something that must be addressed by each and every sector, each and every field, so that we really are able to create greater impact and create a situation where there is social justice, equity, and freedom, and better lives for everybody on this planet. And so this seminar really creates a great opportunity, and it is in this backdrop that this collaboration has great meaning for us to be able to take the findings from the studies that both the scholars of both these institutions have been doing. In fact, this seminar was planned almost a year ago for it to be a face-to-face event, to bring together academicians, researchers, policymakers, and practitioners, and all those who are working in this field, especially in Delhi. However, the pandemic struck, and we had to hold off this this seminar. And in situations of crisis, as you know, you lose some and you gain some. So while we missed the opportunity of meeting each and every one of you face to face, we've now know that, as Priyanka said, we have more than 700 participants joining us on this online platform, which are the gains of this pandemic, where we've all learned to connect through virtual means. So it's absolutely delightful to really have a very large audience to share our deliberations and to draw from a much larger audience on this. And for ISST, this is really an opportunity to reach out to this vast audience and share with them the Delhi focused work that it has been doing in the field of women and informal work, care work, elements of gig economy, looking at frontline workers, looking at adolescent aspirations as they enter into the workforce. And in this collaborative event, we really look forward to discussions to add value and offer future directions for study and inquiry. And it has been an absolute pleasure to work alongside Professor Alak and his team, and Dr. Radhika Kapoor, Mehta Chair of Gender Studies, IHD, to bring this event to you. I once again extend a very warm welcome to all of you, wishing you a wonderful 2 days. And this is back to Priyanka.
Yes, thank you so much, Dr. Dharya. I now call upon Professor Alakhen Sharma, Professor and Director, Institute for Human Development, to give his introductory and welcome remarks.
On behalf of IHD, I also join in according my warm welcome to all the participants. A large number have registered, as Priyanka told, close to 700. They will be joining in the different sessions, of course. Particularly, I am very thankful to Professor Gita Sen, who is one of our most outstanding economists with global recognition, particularly in the areas of gender and development, health, and other issues, who agreed. Gita has obliged Indian Society of Labor Economics, which ISD is a part of, and ISD on several occasions. And I again thank her for agreeing to give the keynote address. I should not repeat in this audience, and I won't take much time. You know very well that India is among those countries in the world where women work participation is extremely low. Neighboring Pakistan, Afghanistan, some Middle East countries, and few countries, maybe 15, 20 countries out of 200 in the world, where this is one of the factors behind all this, and several colleagues have done several of the important works, is measurement. Measurement issues are not unique to India. It is also in other developing countries. It is also in neighboring Bangladesh. It is developing countries, but their workforce participation over there of women have increased significantly. So it needs to be studied, needs to be researched, analyzed, the barrier, and it is being done. We are not the pioneering one, but I think in urban India, the work participation rate is even lower than rural India. Along with that, and again, all of you will be knowing it, along with low participation rate, almost in all states, rural area, urban, women unemployment is much higher than men unemployment. In fact, some states like Bihar, I have seen the figures, it is, for in case of educated women, it is above 50%. I think these are areas which are, and again, we have been talking about and researching about declining. There are several factors, several barriers. I'm not, the seminar will be deliberating on it. I'm not going into that. But Delhi is among those states in the country where women workforce participation is even lower. I don't remember just recent figure, but some years back, it was 1/3 lower than the average urban woman in the country. While traditional surveys, as I said earlier, fail to fully capture the work of women, their contribution in economic activities. The levels of women participation in economic activities in Delhi are certainly less than desirable when compared with other major cities of, just compare Southeast or East Asia. I'm talking about major cities of these countries, Bangladesh, Dhaka, and all that. It is much lower. So it has more to do other than the measurement issues, and we have to analyze all these. There have been income effect, women, and due to education, higher level of enrollment. These are the issues. But again, a major issue is that less and less jobs appropriate for women as compared to males has been created in the economy, including in Delhi. And the institutional barriers, cultural barriers are well known. Gender space is declining, lack of public safety, all these are major concerns. So both demand side and supply side factors in India as a whole, urban India as a whole, but in Delhi in particular, and Delhi is not a small state, it is a 2 crore of people now. So all this needs to be analyzed in depth. Delhi is among, in fact, along with Goa, richest state in the country. And just think of if women participation in Delhi increases, say by 10 percentage points, the per capita income prosperity in Delhi will increase substantially. So and so all these issues, I think, as I said, needs to be analyzed, and this is the purpose of the this two-day seminar. And that is why when this proposal came before us, we immediately agreed. ISD has been doing, and ISST, of course, have been pioneering in research on women's issues. But when this research proposal came, Professor Asha Kapoor Mehta and my other colleagues immediately agreed. And as many of you know, we in the center, we in the institute have created a separate center for gender studies, of which Professor Asha Kapoor Mehta is the chair, to do more and more research. And I'm very happy that this collaboration with ISST has been happening. In this seminar, apart from my colleagues, Professor Asha Kapoor Mehta, Priyanka, Aditi, ISST people, Moria, and Ms. Ratna Sudarshan have worked very hard, and I recognize their contribution. I am sure that the two-day deliberations will be very insightful and give thoughts for further analysis, as well as policy making, contribute to policy making on Delhi in particular and urban India in general. So with these words, I thank everybody for
Dr. Andharya, your introductory remarks and have pretty much set the tone and temper of discussions that will follow in the two-day seminar. It is now my pleasure to invite Professor Asha Kapoor Mehta. She is chairperson of Center for Human Development, a known gender economist, to introduce the seminar, the aims and objectives, and of course the themes of the seminar. I would also request her to introduce the keynote speaker of this seminar. I request Professor Asha Kapoor Mehta, please.
Thank you, Priyanka. It will be an absolute privilege to introduce our keynote speaker for today. But before I do that, a few things. Firstly, let me add my word of welcome to everybody who's joined us at this seminar. And let me add, for all those who are younger researchers who are joining us on this platform, let me say that every time you hear the word low or declining workforce participation rate of women in Delhi or in India, please take a whole, handful of salt and question that, because what you will find will be that it's the official data sets that tell us that women's workforce participation is declining and is low, whereas what I was working on health issues in the context of India, and I came across this absolutely amazing report, which was titled, and I'm flagging this for everybody who's young on this panel, basically in order to say, don't hesitate to call it like it is. Because what she called her report is unequal, unfair, ineffective, and inefficient gender inequity in health, why it exists, and what we can do to change it. And this is not just some arbitrary report. This is a report that she'd co-authored and is the lead author of for the WHO Commission on Social Determinants of Health. So, so that's one. And the second one that I want to ask all the young researchers to look at is her work in Koppal district of Karnataka, where she's, which is seminal work on gender and health equity. So over to you, Geeta. What a privilege to have you here with us to give us our keynote address for this session that Ratna had actually thought of and asked if IHT were willing to to partner ISST on, and look at what has been created, with the partnership of two institutions, because as they say, ek aur ek do nahi hote hain, 11 hote hain. So this is our 11.
Thank you so much, Asha. I'm a bit overwhelmed by that introduction, but I really want to thank both ISST and IHD for inviting me to give this lecture. It's such a great pleasure to be among two sets of friends with both of whom I've had very deep and long-standing connections. I also want to, like you, Asha, remember Preet Rastagi with fondness and sadness. We really do miss her, especially at times like this. I'm delighted to be here because to see these two institutions, when Janvi told me that this was happening, I said, fantastic. What a great idea that ISST and IHD are coming together on a platform of this kind, given the critical challenges to women's work that we face on many, many fronts that we will be delving into during these 2 days. I'm also deeply humbled. As I look at the list of participants, there are many people here who've done cutting edge work on these issues. And I want to thank you and say how much I hope to learn from these 2 days. A keynote lecture means that one has to step back a bit so that we can see the forest before we look at the trees. And so I've called this lecture Freeing the Canary or Killing It. Concerns about women's work in a tumultuous time. Let me explain. In June of 2016, at a talk at the University of Kolkata, or Calcutta, I don't know which way they call themselves these days, I called women's work in India the proverbial miner's canary. Why? For two reasons. First, like the canaries, and the canary is a sentinel species, so called because canaries would be used in the coal mines, held in a cage by miners to give them advance warning if there was carbon monoxide, methane, noxious gases, and so on, that would be a danger to them. So they would be held like that. And similar to that, women's work, I want to argue, provides early warning of trends and tendencies that are likely to affect all workers. And secondly, because like the canaries who kept singing without stopping until they dropped, women sadly keep working without stopping, no matter what the circumstances. Today, I want to point to the fact that the choices we collectively make as a society on policies towards women's labor and women's work will either free the canary or kill it. It's also, as I said, a tumultuous time with plunging GDP growth, sharp increases in unemployment, further declines in women's work participation rate, about which I'll say more, while women's work burdens have never been higher than they are today. First, some parameters for our discussion before plunging into some of these, seeing the woods, as I said, before focusing on the trees. The structural factors, and some of these things we all know really well, but I do believe that they bear repetition because we need to keep them in mind as we think about the different aspects and issues related to women's work. First, the structural factors that shape women's work, both paid and unpaid, are, on the one side, the broad drivers of capitalist production in what is really a capitalist economy. Secondly, on the other side, gender systems in which patriarchal households and families predominate. And thirdly, traditional caste and jati hierarchies that still shape and govern the work that many, many people do. The precise implications for women's work flow from these, and they include an economy and society built on private ownership of the means of production, where workers are basically a tool or a mechanism for the accumulation of profits, and their costs are meant to be minimized while their productivity is maximized. Human reproduction, both daily and generational, as a result, is viewed as a consumption cost rather than as an investment. This means, of course, that there's always a need for state policies to counter these tendencies. And those state policies, of course, don't fall like manna from heaven. They have to be struggled for, pushed for, advocated for, argued for before they come into being. A second implication is that unequal gender power relations define households and their distributions of assets, incomes, and the division of unpaid care work. And this is cemented by strong norms of masculinity and femininity. What is okay for boys and men to do versus what is okay for girls and women to do. And of course, all of this cemented by a very heterosexually normative system. And often these systems are policed by older women themselves. These unequal power relations are intersected by age, by marital status, and by ability. The third and equally critical element are the caste jati hierarchies that define who can do different kinds of work and who must do some kinds of work, reproduced by, in today's world, differential access, not only to incomes and assets, but to education and knowledge in a critical way. Norms governing social and cultural interactions, somewhat attenuated in urban areas, but by no means eliminated. And all of these three are intersected in complex and diverse ways by religion. And it's important for us to remember that caste and religion particularly are often very closely imbricated. Now, this is sort of the general background, and it has been true for quite some time. In the neoliberal economic order that in our country began somewhere around, one could say, the mid-1980s, and especially after 1991, these inherent tendencies of the capitalist economic system have been strengthened considerably. As the national economy has become increasingly tied to the global economy, with significant benefits for those with access to higher education, and that means incomes, wealth accumulation, and consumption. Secondly, growth and employment are linked to the globalizing economy. The production of consumption goods, of construction, of financial and other services, to some extent of IT-enabled services, and linking to the global value chains in many different ways. Thirdly, increased downward pressure on wages and working conditions, and towards informalization and casualization of jobs, towards more and more contract labor and daily labor without contracts, even as work is increasingly part of global economic chains. Work becomes more flexible and more precarious, as we all know and witness for the last 2 decades or so. Fourthly, and this is related to the fact that, as I said, government policies and government action are a needed counter to the inherent tendencies of a production system where workers are seen or as a cost. Downward pressure on government spending at both central and state levels towards what is called greater fiscal responsibility. And a churning in traditional caste orders as many who are left out of this rapidly moving system scramble for access to government jobs, to contracts, to elected office. The full caste and gender stories of what these changes mean for paid and unpaid work have not yet been researched or understood. Of course, a caveat is that research such as what will be discussed during this seminar certainly helps us move in that direction. But the broad policy options that we have witnessed in the context of neoliberal globalization of the system are, and I'm talking roughly from UPA 1 onwards to now, two different directions. One, in the direction of ameliorating the exploding inequalities of neoliberal globalization through government programs to improve access to jobs and work, to food, access to education, to health. Deeper democratization through rights to information, greater public consultation, decentralization. Or in the other direction, greater centralization of executive power, shrinking democratic space, and reduced transparency. Note that in both approaches, neoliberal globalization continues, but one could argue it does so with or without, as we used to say in the early days of structural adjustment programs, with or without a human face. Now, so the first critical issue is the one that I want to pick up for women's work is the famous work participation rates. Asha threw out a challenge very early saying, are the work participation rates really declining? And I think it's a very good question to challenge us with. What we do know, at least in the official data, whether government, whatever that is now, and World Bank estimates, after decades of steady increase, a precipitous decline over about a decade and a half. In 1999, 2000, we had a female work participation rate of around 34%. By 2005, 2006, and you can see the precipitous nature of the decline, it was down to 26%. And by 2019-20, it had fallen further to around 20%, give or take, but these are orders of magnitude that are more or less correct. Some of this can be explained by more education, but by no means all of it. And the combination of the following: the absence of women-friendly jobs, either rural or urban. Now, if we look at where do women work for pay? Home-based work, small-scale services, street vending, rag picking, so on. Agriculture and allied processing, construction, some extent in services, and to some extent in global manufacturing chains. But what we've seen, I think, during this same period, and anybody who knows how the cheap Chinese imports, in fact, have flooded our markets, knows also the shrinking of traditional crafts and small production is not matched by increases in work for global value chains. Secondly, there's a crisis that we know well of significant proportions in agriculture, always a place for women's work. Third, limited growth in labor-intensive global value jobs. As Arvind Subramaniam, with whom I don't generally agree on economic policy, had a great word for it. Premature in the deindustrialization is what he called it. Fourthly, a casualization and informalization of work as part of the neoliberalism in health and education. Look at what we call our frontline health workers. We call them volunteers. There's nothing voluntary. It's work. But what it means is that their work is complete. The work of the ashas is completely casualized and informalized, so that government jobs have been moved towards casual and informal work. It also means there's a huge pent-up demand for jobs among young women who have higher education than their mothers, but very few options. And we might call this, in a sense, the lost demographic dividend. So while I think it's true that one can cavil about the extent to which there has been a true fall in work participation rates, I do think work for pay has declined. Now, this brings us to the question of unpaid work and care work. We know that it is largely 80% or so is done by women. But let me put in a caveat, and this is of course related to that question of what is work participation, about unpaid work. While unpaid non-care work involving fetching fuel, fodder, water, etc., is supposed to be included within the 1993 SNA, System of National Accounts, production boundary, it is in practice rarely included. And in 1985, that's, centuries ago, before some of you were born, in some work we had done, we had found that on the basis of the very first NSS survey on domestic activities, the big differentials in work participation rates across states and regions shrinks dramatically when such domestic activities are added to the work participation rates. It isn't therefore a question of whether women work, or are they sort of lying on a charpai gazing at the trees, but it's a question of what kinds of work they do, whether and how much they get paid for the work they do, and how they do it in different parts of the country. Unpaid care work done largely at home has received a fillip in recent years towards much better recognition, thanks to the 2019 Indian Time Use Survey and the work of people like Dr. Indira Hirve and many others. Third, changing care pressures affect unpaid work and care work. Changing care pressures due to demographic change, aging for one, but also rising non-communicable diseases, as well as diseases like drug-resistant TB. All of these involve an increase in the care burdens for healthcare at home. Fourth, unmet needs for childcare and elder care in a neoliberal economy, and as Ingrid Palmer called it many, many years ago, a hidden tax as a result on girls and women. As a consequence of this, the famous care diamond, that is the four-pointed diamond with states, markets, households, and civil society and other organizations as the 4 points of care provision, is mostly a single point in our context. Maybe 1.5 points if you include a little bit of what the state does, but otherwise it is largely in the realm of households. There is, of course, internal migration from states like Uttarakhand, Jharkhand, and so on to serve care needs in metropolises like Delhi, but this is mostly paid care work. In this context, which, as I said, has been going on for over for around 1.5 decades, but exacerbated by neoliberal policies, we have COVID-19. And here I'm drawing for what I'm going to say here quickly, on the excellent, and if you haven't seen it, State of Working India 2021 reports. It's the third report in a series that began, I think, in 2018. The first report, one was missing in 2020 for the obvious reasons, which itself, the report is based on CMI data plus 2 other limited surveys. The report looks at what happened in the lockdown and what then happened to jobs in the months thereafter, ending somewhere around the end of 2020. So what do we know? 100 million jobs were lost during the April-May lockdown, but by December of 2020, 15 million of those people were still out of work, so that they didn't all recover. And of course, monthly per capita incomes fell from the beginning of the year to about October by almost 17%. Labor's share of GDP as a result fell from 33% in 2019-20 to 27% in 2021. And these are second quarter data. Women workers were disproportionately affected as a result. While for men, 37% lost jobs, but only 7% still had no jobs by the end of 2020. Women, 81% lost jobs, as against 37% for men. And by the end of 2020, as against 7% for men, 47% of women were still out of work. And there was a similar but not as stark trend for young workers between the ages of 15 and 24 as well. While men tended to transition from work to employed work to self-employment, for women, there was a downward slide from every category of workers, salaried, self-employed, daily wage earners, to unemployment. And of course, migrants had much higher job losses and had much poorer access to rations than non-migrants. Remember that in Professor Ravi Srivastav's estimates of 2017-18, there are 140 million circular migrants in India. About 80% or a bit more than that of both long-term and short-term combined are in precarious work, precarious jobs. There were caste religion differences as well, which is important to keep in mind. While non-Dalits and Hindus tended to go into self-employment, Dalits and Muslims went into daily wage work. And this, of course, shows us the divides in access to assets for self-employment. Hindus also tended to go more into agriculture, while Muslims fell back on petty trade. There were big outflows from education, health, and professional services. And of course, the poorest 2 deciles, the bottom 20%, were the worst hit. There was a 15 percentage point rise in rural poverty and a 20 percentage point in the urban areas, rise in urban areas. Households coped through reduced food intake, increased debt, and while the report doesn't mention it, I'm certain on the basis of the evidence we have, increased unpaid work by women. So, Are we going to free the canary or kill it? First question, which direction will the new labor codes move us? Those new labor codes are the Code on Wages of 2019, the Industrial Relations Code of 2020, the Social Security Code of 2020, and the Occupational Health, Safety, and Working Conditions Code of 2020. Remember that the last three were passed during the pandemic in September of 2020 and without discussion in Parliament. What happened was that there had been earlier bills which had been discussed in the Standing Committee in Parliament. These were replaced, but they were never properly discussed. These codes, sadly, move us towards killing the canary. They've made it easier to fire workers and reduced access to justice for workers, with reduced penalties for employers and increased penalties for workers. They've set 300 employees as the bar for different things. For instance, putting out standing orders about working conditions and safety, whereas it used to be just 100 employees before. And 300 employees means very few enterprises will be covered. There's a much, much bigger scope for contract labor. While Social Security continues to be fragmented, this rewriting of labor codes was supposed to reduce the fragmentation. But on Social Security, we don't see much of that reduction of fragmentation. And in fact, we see something else, an overdependence on CSR and ad hoc welfare schemes by the government. There are no common minimum standards for occupational safety for unorganized workers and no prohibitions on women workers, whatever we may think of them, in hazardous occupations. So finally, what is needed to free the canary, to support women workers? First, and most important, we need jobs programs to halt and reverse the precipitous decline in work participation rates. We need an urban version of Manrega. We need support for IT-enabled services because we are not really going to compete with China in manufacturing on the global chains. We need incentives for linking to national value chains through improved design and marketing for crafts and artisanal production. Secondly, we need recognition and formalization of health, child, and education workers who are informalized and casualized, and an expansion in these cadres. This will give us both better services and more job creation. Ashas, Anganwadi workers, and so on. Thirdly, we need a significant and serious expansion of Social Security, both increased food and cash transfers. Jan Dhan is good with women accounts, but we know that its reach is limited, and we have plenty of evidence about that. Reduced burden of unpaid care work, unpaid work, both care and non-care. And that includes the clean fuel initiatives, for instance, are good. But again, we know the limitations in their implementation. There's a critical importance of childcare facilities, both, and this again is another one of those that will lead to more better services, critical services needed by working women, and job creation. Safe and affordable transportation and safety in mobility. And finally, serious movement towards eradicating violence against women and girls and sexual harassment in workplaces. I've tried in this talk to give sort of a broad sweep picture to sort of set, in a sense, some parameters within which much of our discussion during these 2 days, I think, will be located. And I really look forward both to your comments and suggestions, as well as to the discussions that will come up. Thank you so much.
Thank you so much, Geeta. Overwhelmed as always, and your canary example will reverberate in our ears for years to come. Kill it or save it, and how to save it. You know, these are extremely critical points that you've made, and the gamut of issues that you've covered is huge. We've got a few people who asked questions. In fairness to them, let me start with, with raising those questions with you. Sandhya Iyer is asking that given the overlap between housework and household enterprises, wouldn't it be useful to add them within the measures of labor force participation? And she says, rather than asking the question whether they're seeking jobs, the question should be what jobs are women workers involved in? And our questions on labor force participation rate need to be rephrased. Perhaps that will help us better estimate the differences between the employed and unemployed, and she wants to seek your views on this. I just add one or two other questions and then ask you to answer. Dakrushi Sahu wants to know what is the causal linkage between unpaid care work and time poverty in India. And Smita Mohanty wants to know if we can get the research papers that you've referred to. And of course, then there's the congratulatory comprehensive lecture, thanks, and extremely rich in building the contradictions and challenges and capturing the limitations of our women's role in development, etc., etc. So while we put together more
Can I ask you just to repeat that second question about the relation between unpaid care and?
Yeah, causal linkage between unpaid care work and time poverty in India.
And the third, just again.
Okay, let me just repeat all the questions. The first question was, given the overlap between housework and household enterprises, wouldn't it be useful to add these within the measures of labor force participation? And this is from Sandhya Iyer, and she continues with, wouldn't it be useful to add these within the measures of labor force participation? Rather than asking whether they are seeking jobs, shouldn't we be asking what jobs are women workers involved in? And the need to rephrase our questions to get better estimates. So that's one set of questions from Sandhya Iyer. And then Dakrushi says, can you provide insights on the causal linkage between unpaid care work and time poverty in the Indian context? And then there are other questions.
Okay. I think on work participation rates, the overlap between housework and household enterprises. Work in household enterprise, as there's a lot of conceptual work that has already been done that has helped clarify over the years the relationship between paid work, unpaid work, domestic activities, care work, non-care work, etc. And I think I would certainly refer you for clarity on this to, I think it was a paper that Indira Hirve did, probably given originally as a lecture at ISLE, the Indian Society for Labor Economics, somewhere around 2015. And maybe if Indira is here, you can just put the link onto the thing, which was a very nice sort of laying out and clarification of these connections. There's not so much of an overlap as you think. Household enterprises, it depends whether in fact there is a household enterprise that is going on. And much of women's unpaid care work is not connected to household enterprises at all. Should we be asking what work it is that women do? I really think that we should. I think that the Time Use Survey 2019 makes a move in that direction, although it's a limited survey and we need more than this. I do think that the NSSO's multiple surveys that have looked at domestic activities, starting, as I said, with the one in, which was, I forget, the paper we published was in EPW 1985. So it was obviously before that, and I've forgotten which year it was. But there have been a number of such. After that, Avanti Mukherjee did a PhD at JNU, which analyzed this whole set. And I think that it's a very underused set of data, which I would really recommend people to look at, because it tells you, like with all the detail of NSSO, which women, what work exactly are they doing in which kinds of so-called domestic activities? Are they fetching fuel, water, kitchen gardens, care work, etc.? So I would strongly recommend both those. Second question on the causal links between unpaid care and time poverty. Of course, there's a very close connection. Women's time poverty or women's excess time poverty over men is very strongly connected to unpaid care. And we know that, and there's plenty of both micro and more broad survey evidence that tells us that that is the case. And not just in India. Just a quick example, in Sweden, now this is, I think, about almost maybe 2 decades ago, they did and it was a health survey. They did a survey that looked at the higher levels of paid employed. I think they were manager or high professional categories of men and women, and measured, and this was an objective measure of stress levels through looking at, blood data. And what they found was that for men, if you plotted the stress levels over the workday, it would be unimodal. It would go up, sort of peak around, midday, and then start falling off. And by the evening, it was gone. For women, it was bimodal, with both modes being almost equally high, and the second mode coming at the end of the workday, as the women rushed home to do all of the unpaid care work. That is Sweden. So this is a challenge across countries that we know. And in our context, we know that it is absolutely closely linked.
Geeta, we've got lots more questions, and I don't want to ignore them. So I'm going to just run through them quickly, 4 questions. And if you can give us brief answers, because we do need to close the session. I'm getting these alerts. But I've said I'm allowing spillage, so we'll just take them quickly. The first is from Himmat Singh Ratnu, who says, how do you think the capital, gender, jati, religion nexus can be broken? The second is from Ridu Lipan, who says, Geeta, at the end, when you outlined what is to be done, what about programs for educated women? Jyoti Thakur says, if we include care work in the measure of labor force participation, then LFPR will go up, but then women will still not have money. Who's going to pay? And Indrani Datta says, excellent analysis, but what about sex work, which has been gaining ground during the pandemic? And then there's more questions, but I'm sorry, Mahua, I'll have to stop here.
Okay, all great questions, and let me do them complete injustice by giving them 20 seconds each. I'm going to leave the jati, gender class nexus
answer.
question for the end. Very good question about educated women. I think the direction for educated women, and that's why I said, and I've long been a believer that IT-enabled services are critical. We are, and they don't have to be just for the global economy. The national economy is different today. We need these services, and we're not doing sufficient in order to help women get into these kinds of services in a much bigger way. As I said, manufacturing, I don't see us somehow suddenly becoming in the next decade. And I would love to be proven wrong, a powerhouse in manufacturing. But we do need to look at what we can do for services there in other industries that are service sector industries in the national economy, as well as global chains. Care work, I've forgotten what the care work, if you include care work in work participation rates. No, it's not about including unpaid care in. And remember, paid care should be part of work participation rates. Work participation rates are about paid work. And to that extent, I don't have a problem. I don't believe in mushing all the categories in together. But we do need to recognize, because there used to be, believe it or not, a notion before in 3 decades ago, that the women in the low work participation rate regions of the country don't actually work as much as, so this would be Punjab, Haryana, and so on, versus the south of the country. And so the point is to say, of course, women are working. They're doing paid work and unpaid work. It's the balance of these two, as well, both unpaid care and unpaid non-care work. And we need to keep those categories, but to see the links and connections between them. Sex work, absolutely. And sex work, in fact, is, as we know, one of the Azim Premji, State of Working India, did not, I think, and if somebody knows better, please correct me, did not pay attention to this. I don't think they're picked up. It's illegal, so they're not picked up in CMIE and other surveys. But we do know that if there is a fallback for poor and particularly uneducated, illiterate women, it's going to be sex work. And we know that sex work has exploded despite all of the risks and dangers in the time of the pandemic. And absolutely, we must move that towards both recognition and appropriate support for the workers.
We're out of time, Agita, but thank you so very much for taking the time to be with us for this. Handing back to Priyanka to start the formal vote of thanks from Raji.
Thank you so much, Dr. Geeta Sen and Professor Asha Mehta. Thank you, Dr. Sen, for such an insightful address. And of course, this is, as I said right in the beginning, this is going to set the tone and tempo of the discussions that will follow through the day. And thank you so much, Professor Mehta, for moderating this lecture and taking on the questions which have not been which we have not been able to take up. I'll compile all the questions and I'll share it with Geeta ma'am, and she can of course answer them at her leisure time. And I now call upon Dr. Rajiv Nandi. He's Associate Director and Research Fellow, Institute of Social Studies Trust, to propose the vote of thanks in the inaugural session of this seminar.
Thank you, Priyanka, for requesting me to propose a vote of thanks today. Dear Chairperson, distinguished guests, panelists, friends, and colleagues, it's my privilege to propose a vote of thanks on this occasion of the inauguration of the 2-day virtual seminar on women's work in Delhi, dimensions, challenges, and emerging issues, organized by the Institute for Human Development and Institute of Social Studies Trust. I, on behalf of the Joint Organizing Committee, extend a very hearty vote of thanks to our keynote speaker, Professor Geeta Sen, for gracing this occasion with her presence and support. Friends and colleagues, Professor Geeta Sen always supports the ideas of opening up spaces for critical interaction and debates among researchers, scholars, practitioners, and policymakers. When we approached her with our idea and invitation, he happily supported our ideas. We are immensely thankful for this gesture and for raising the occasion with her presence and setting up the tone of this seminar. We'll remember your valuable analysis and recommendations, Professor Sen, during these two-day-long webinar and while drafting our future research agenda. I remember ISST and IHD started planning this event in early 2020 before the COVID-19 pandemic broke out. In last 1.5 years, we faced many challenges, and finally we are successful to take our ideas forward to organize this important event. All credits go to Professor Alak Narayan Sharma, Professor and Director IHD, Professor Asha Kapoor Mehta, Chairperson Center for Development Gender Studies IHD, Dr. Tanuka Endau, Center for Gender Studies ISD, Ratna Sudarshan, Trustee and Forward Director ISST. All of them always remain positive and determined to organize this event. We are extremely happy to acknowledge your leadership, guidance, and in designing this webinar. Dr. Janvi Andharia, though joined ISST only about 6 months back, showed all her enthusiasm to organize this important webinar and provided an excellent leadership and support to give the final shape of the webinar. I must mention our deep sense of appreciation for our colleagues at IHD and ISST, Priyanka Tyagi, Aditi Madan, Jyoti, Shaini, Kamalika, Monica, to provide all technical and logistical support. They were silently doing all designing and executing each bit of this webinar. I just can't say thanks to them. I just congratulate the joint team for the wonderful coordination. Finally, let me put on record our hearty thanks to all chairs, panelists, and presenters for the technical sessions, for accepting our invitations. We are looking forward to the technical sessions with rich presentations and meaningful discussions. Thank you and namaskar. Looking forward to see you back in the first technical session, which is going to begin soon.
Thank you so much, Dr. Nandi. Now, this brings us to the end of the inaugural session of this seminar. We will now immediately start, as we are just 5 minutes, there has been a 5-minute spillover, so I'm sure we'll be able to pick it up with this first session of the seminar, which is Women's Work and Challenges Faced by Women in Informal Employment. The chairperson of this session is Ms. Renana Jhabwala. She's President Seva Bharat. The presentations in this session will be made by Dr. Balwant Singh Mehta. He's a senior researcher from IHD, Dr. Monica Banerjee from ISST, and Dr. Swati Datta, again, senior researcher from Institute for Human Development. The panelists in this session are Dr. Radhika Kapoor. She's Senior Visiting Fellow, Indian Council for Research on International Economic Relations, ICRIER, New Delhi. Dr. Farzana Afridi, she's Professor, Economics and Planning Unit, Indian Statistical Institute, Delhi. And Ms. Sunita Sanghi, former Principal Advisor, Ministry of Skill and Entrepreneurship, Government of India. I request all the resource persons of session 1 to kindly switch on their video. And if we can do a quick audio check of all of them. Welcome.
Hi, Priyanka, Sunita Sanghi this time.
Thank you so much for joining in. Welcome, Ms. Renana Jhabwala.
Yes, happy to be here. And I was listening to Geeta's presentation and was pleased to hear her speak again.
Thank you so much, ma'am. Can we hear Dr. Radhika Kapoor, please?
Yes, Priyanka, I'm here. I'm audible.
Nice. Welcome, Dr. Kapoor. Professor Farzana Afridi.
Yeah, I'm here. Hi.
Nice, ma'am. Thank you. Welcome to this session. And of course, Sunita ma'am has said hello. We have Dr. Balwant Singh Mehta. His presentation is the first one. If we can hear from him. Dr. Mehta, please. It's like a roll call. Dr. Mehta. Okay, so we have Dr. Swati Datta, I can see her, and Ms. Monica Banerjee. We can kindly coordinate with Dr. Balwant Mehta. We have not been able to.
Hello, Priyanka.
Hi, Swati. Hi, Swati. And if we have Ms. Monica Banerjee here, please.
Hi, good morning, everyone.
Good morning. Welcome to this session. So just before we begin, and thus as Dr. Mehta joins in, I would request all the presenters to please keep up to the time limit of 20 minutes. And of course, the chairperson will take care of all the moderation of this session. And if this chairperson needs any facilitation, we will be happy to alert the presenters at 18 minutes. 2 minutes before their presentation. Thank you so much. I now request Ms. Renana Jhabwala to please moderate the first session of this seminar, which is on women's work and challenges faced by women in informal employment. Ms. Renana Jhabwala,
thank you, Priyanka. And good to be part of this IHD, ISST seminar. And I'm so glad that we can all do it sitting in our own place at home or in our offices or wherever we are without having to travel. But the drawback is that after the inaugural session in a normal seminar, we'd all be mixing for tea and at least, having a cup of tea and seeing each other. So we're going to miss that, but we can see each other. So that's nice. So before I start, I think this particular session is focused on Delhi, basically. I'd just like to say 2 or 3 things before we start. Firstly, reminding everybody today, I know Geeta Sen alluded to it, but I'd like to be very specific, which is what we have always believed, and I think other people are coming around to believing, is that the NSS work participation rate of women is grossly undercounted because a lot of work is left out for various reasons, which I won't go into now. And I'm talking about work which should be counted as paid work. And the second thing is that, again, the NSS is showing a falling work participation rate. We don't believe that's true. And other people too are coming around to that, especially the NCAR data is showing that there really isn't a fall in work participation rate. So, a lot of our beliefs are based on that. And the other day I was listening to not a podcast, but a panel in which the South Asia chief economist of the World Bank was there. And he, of course, same myth, everything is falling and women are not participating and so on. But he was also gave his own explanation, which he said was that the norms are such that women are not participating. We do need to challenge that. And in fact, I think Ashwini's latest paper, Ashwini Deshpande's latest paper does show that it's really a lack of opportunities where women are not participating and not the norms where, women have the norm of sitting at home. So I think we need to keep challenging these mainstream myths about women and work. And I'm talking about paid work right now, not unpaid work. And paid work, of course, defined in the larger way that NSS defines it. So I think we need to keep challenging that. The second thing, though, is that the whole issue of opportunities. And in Delhi, SEVA is working in Delhi. We have about 50,000 members in Delhi. We've worked with ISST also extensively. And I think what you believe and we believe is that we absolutely need to be making the opportunities. There is a big pushback from the formal sector, from employers for women workers. But how do we create opportunities? How do we have a policy environment to make positive opportunities? And how do we deal with this challenge of pushback from employers? I mean, we face it all the time in SEVA, where educated or where we have skilled the women, and yet the employers are not ready to employ them. So just with those opening remarks, I'll go to the paper presenters. I think we really should be very careful of time because we have a hard stop at 1:30. At least I have to leave at 1:30. Is Balwant Mehta here yet?
Dr. Mehta, he has just joined. Dr. Mehta?
Why don't we start with Swati then?
Yes, the second presentation is by Dr. Monica Banerjee.
Monica Banerjee.
Yes,
okay.
It'll be nice if we move
yeah,
on.
Monica. So can we start with you?
Yeah, sure.
Okay, great.
Yeah, I would need to share screen.
Kindly go ahead if you can share your screen. And
thank you so much.
And we can see your screen as well. Thank you
so
much.
Okay.
A warm welcome to everyone on behalf of ISST. And thank you so much for this opportunity for making a presentation of a study that ISST did 2 years back. I also would like to say that I'm a little jittery about presenting just after Dr. Geeta Sen. There's a lot of issues that she has already raised. I hope I can do some justice to some of the things that she has already said. But anyway, I'll start off. So my presentation is basically looking at care work, something very close to a lot of work that ISST has been doing over the last 2 decades, where we have constantly been trying to showcase the care work that women are constantly having to put their time into. And this study was done in collaboration with mobile creches to see and understand the vulnerabilities of children of informal sector workers, to understand, what are the challenges that children face. Initially, the idea was to cover 5 sectors, which were the domestic work, construction work, street vendor, and waste picking and sex work. However, we could not collect any data from the sex workers. Very few sex workers could be surveyed, and interviews were done. And hence, I have not included that because, frankly, we could not get much headway into that. And that's another issue that I think Geeta Sen has also flagged out. It has also emerged as a question in the previous session that, what about sex workers and such special categories? I will only focus on the 4 other sectors that the study focused on. This is the waste pickers, the street vendors, domestic workers, and construction workers. The research methodology of this study was a purposive random sampling where we identified respondents on the basis of 3 aspects. One was, they must have at least 1 child who is under the age of 6. They should be working in any of these 4 areas. And even if they are not employed at this point in time, at the point of time when the survey was done, they should have worked in the last 12 months at some point in time in any of these 4 sectors. So quantitative data was collected with 426 respondents across Delhi, and the forces partners helped in this endeavor. And then the quantitative data was followed with qualitative data, which was collected through FGDs, which ISST researchers themselves conducted. In total, 13 FGDs were conducted for this study. I said 13 because 2 were done with sex workers, but I have not included here. It's 11 FGDs and 426 in total respondents. We collected data from 147 domestic workers, 81 construction workers, 100 waste pickers, and 98 street vendors. And as you can see from the pie chart, the respondents stayed in several across Delhi. So majority were from north and the south districts of Delhi, but they were also, spread across other districts of Delhi. So I just want to say that I have not included that data here, for time reasons, but basically all of these respondents are marginalized women who lived in unauthorized colonies, JJ clusters, resettlement colonies. And hence, provisioning of public services was a huge challenge, which we found in all of these areas. Long queues for water. In some of the areas like Rangpuri Pahadi, water had to be purchased on a daily basis. So crisis of water was a huge thing, even Shadab Dairy. The other thing was access to Anganwadi. So even if the Anganwadi was there, for example, in Rangpuri Pahadi, it was fairly far off. So for women to again drop the child, get back, it was difficult. Other things like drainage, sanitation, those were again other issues that women were facing. So we see that, apart from the paid work that the women had to do, there were other challenges that women had to constantly face in terms of other unpaid care work. So how is the work organized in terms of the household? We found that majority of the work was done by women. So if you see in this graph, whether it was childcare or domestic work, which was done inside the household, or fetching water or household work, which was done outside the household, majority of the work was done by women themselves, where 84% was, in terms of childcare, or inside household, almost 93%. In the outside work, we saw that the woman and her husband kind of shared the work almost on a 50-50% basis. But other than that, all else, fetching water, household work inside the house, childcare, all of that was majorly the responsibility of the women worker. The older girl child, and in fact, I would say the data here shows older girl child, but our FGDs also showed that older boy child, any sibling. And when I say older, I do not mean 14 or 15-year-old older, but even a child who is probably 7-year or 8-year older were found caring for a younger sibling in majority of these areas. So we saw that the older children were taking care of and sharing the unpaid care burden with the women. Now, all of these women were working, and hence we wanted to find out how are they really, since they are the one who are majorly responsible for their looking after their children, how are they really managing it? And we found that leaving the child alone at home, leaving the child alone at home was one of the main, strategies that women used. And second came leaving the child with a sibling care. Now, there's a difference here in terms of the sectoral work that the women do. So when we see domestic workers or the waste pickers who are specifically working in godowns, where there's a contractor and the woman has to be in the godown from morning almost 8 o'clock to evening 6 o'clock or 7 o'clock, women are not able to take the child. So in terms of leaving the child alone was more of a strategy for these two sectors, women working in these two sectors, and when we, the FGTs found out that was more because the employer did not allow them to bring the child to the center. We in one of the godowns, we met a young girl of 17-year-old who had a 1-year-old child, and so she used to leave the child alone. Her husband used to work at night, and she used to leave the child alone in the house. But she had actually asked a neighbor who was also a young girl of 14-15 probably, and she was paying that young girl about 300-400 rupees every month. She was paying the young girl 300-400 rupees every month to look after the child. While we were there, the young girl brought the child to the godown so that this women worker could breastfeed the child, because that's all that was allowed, and then took the child back. But the woman worker herself was not allowed to leave the godown before 7 o'clock in the evening. So she had to stay throughout the day, and she could not bring the child in. Similar things were found in terms of the domestic work also. Majority of them stated that the employers did not like if they brought children brought children to the employer's house.
Sorry, can everybody who is not speaking mute themselves?
Thank you. In terms of street vendors and construction workers, however, we found that women could take their children with them. Street vendors, mostly who we spoke to, were either working just outside their house or a nearby market, and so they usually took their children with them. The children would go to the school or go to the Anganwadi, or then the child would accompany the mother with them, while the mother is selling things. In the construction work areas also, we found that mothers took the child because the contractors usually never had a problem if the children was brought in, as long as the woman is able to constantly continue to work. So this was basically the care and arrangement and strategies that women were following. In terms of Anganwadi service, we found that majority of women did not prefer using the Anganwadi service. The main reason was the fact that one, Anganwadi was not very suitable for very young children, especially those who were below 3 years old. I'm sorry, those who were below 3 years old. And also because Anganwadi did not have facility like a toilet facility. And sometimes the children would just come out of the Anganwadi. In many places, it was also found that Anganwadi would just open for 1.5 hours. So, or just for giving out the khichdi. So women did not prefer sending their children because it became more of a liability for them, dropping the child and again getting the child back, or something that their older siblings would have to do when they are not there. So they would prefer that the child is home, at least then they don't have to, come back within the, during the time of their work. How did this? Therefore, what we see is that women are juggling between especially their child care. I will not talk about other unpaid care, of course, that is also constantly happening, but they are also doing their paid work, and they are having to work because there is a necessity for getting earnings to home. And we see that because women have very young children, there is a need to constantly take leave, and leave taking becomes a huge problem for majority of these women. We saw that many of them said that they had to take more than once in a week, or at least once in 15 days they had to take leave. And this did not go very well with the employers, especially and this was specifically a challenge for those who had employers, domestic workers and waste pickers. And therefore, the challenges were threat for, loss of jobs, scolding from the employers, loss of earning, pay cut, and several others. So it was really difficult for them to kind of constantly manage work. We also saw that women's, categorically worked near their home. So they did not, whether it was street vendor or a construction worker or a waste picker or specifically domestic workers, they did not like working very far off. So majority of our respondents out of these 426 worked in where the commuting distance was not more than 15 minutes. Or maximum 20 minutes. 15 to 20 minutes was the commuting distance, and that is where the range that they would like to work, so that they could just come back and look after the child as and when possible, especially for domestic workers and construction workers if they're leaving their child alone. So then we find that obviously when women are constantly multitasking, there is an issue of time poverty, and women are constantly struggling to manage several things at the same point of time. We see that domestic workers have no time to rest because majority of them, these are all part-time domestic workers. They leave early in the morning. They do some of the houses where they work, come back, do their own unpaid work, cook, feed the child, again go back for the second round of work. So they are constantly, working. The waste pickers also, in fact, waste pickers and construction workers did say that they had some resting time because they were not leaving their workspace, and they were bringing they had to stay in their workspace. So they got about a half an hour, 40-minute break in the middle. But other than that, the street vendors who were again working near their house, we found them constantly multitasking. So they were going inside the house, cooking, and again coming out and sitting on there. So specifically those who were working just outside their houses. There were several activities which were done, while they were also resting. So we see that only 10% actually did rest. Other than that, majority of them were constantly doing other household work during this period. This also had an impact on the health of the child. So the study found that, out of these 426 respondents, 78% said that their child had fallen ill in the last 6 months, whereas only 22% said that they had not fallen ill in the last 6 months. Most of these children, as I have already mentioned, live in unauthorized colonies, and they also, when they accompany their mothers, the working conditions where the mothers work, and there's no specific space for the child to be in, children are usually, right there where the mothers are working. And hence there are chances of accidents. There are chances of, children putting wrong things in their mouth. It is very difficult for the mothers to focus on their work and also look after their child. So, there was huge impact on the health of the child also. We see that the problems are at several levels. Women are unable to take on work which is probably would be better paying. They are able to negotiate better wages. They're not able to do that because they're constantly keeping their childcare work in the central. Their child and their housework is central, and somehow their paid work is kind of arranged around it. Safety of the child is again another thing that is there. I mean, child is not getting very special time from the mother. The mother is, whether when the mother is at home or at the work site, the mother is not giving specific care to the child. The mother is, constantly doing other things while she's also looking after the child. So child is not getting the kind of care that the mother should be able to provide. And of course, the sibling, the older children, and as I said, these are not 14, 15-year-old, but starting from 7 onwards almost, they are unable to go for their, attend schools on regularly. They are also having to, cook, clean, and share a lot of unpaid care burden for their mothers, because the mothers also have a need to do paid work. Then the challenges are basically at 3 levels that we see from the study that is emerging. We see that women are taking up paid work, which lets them attend unpaid care work. Women spend a large amount of their time in managing domestic chores and care work because there are lack of basic amenities. And we see that unpaid care work in some ways is kind of conditioned that this is a woman's work, and therefore it is very difficult for women also to say that to ask for help or to ask for the need to share, in a rightful manner for sharing of unpaid care work. In terms of policy solutions, the study highlighted that a better definition of a more expanded definition of work would help in bringing more valuation to the unpaid care work that women do. It would also help women to negotiate for better wages and right to take leave and social security. Employers will be pushed to make arrangements for childcare, and this may lead to more women coming into workforce. Better provision of public services, as I've already said, whether it is water, whether it is sanitation, drainage. Since these public services are not available, all of this work falls on women, and women have to spend a large amount of time. And quality full-day childcare and after-school care and elderly care facilities too, if possible, is an essential need to ensure that women's care burden eases and they are able to participate in a better way in the economic world. This would also help, younger children, especially girls, to go out and get better education and play activities, because then the care burden will be eased from them too, and younger children will get a more stimulating and safe environment. Gender sensitizing programs in schools and colleges. I mean, ILO has been constantly saying, talking about the 5 hours and the need for, bringing more recognition, reduction, and redistribution. But I think it's a long call until and unless there's an attitudinal change in terms of how we view work and, how we understand work as to whose work is. So hence, gender sensitizing programs at the school level itself, the college level itself, may bring in more attitudinal changes towards gendered role and care work activities. And this would help in sharpening the call for 5 hours, which are recognition, reduction, redistribution, reward, and representation. I would end my presentation here and would look forward to your questions. Thank you.
Thank you. Thank you so much, Mohan. That was really interesting. And I think you brought out very starkly how women have to look after their small children, how both the children, the women, and one thing that you may have gathered and that you haven't put in is how it mentally affects her work. Anyway, what you did bring out was very stark and very disturbing. I think we'll move to the next, and thank you for being exactly on time or a little before time.
Thank you so much, Raj.
I see Ms. Balwant Mehta is there.
Yes, ma'am. Dr. Mehta has joined. He can now present.
Okay, I can see him. I mean, okay. I can't see him. Please put on your video.
Okay, ma'am. Okay. Good morning to all, and Priyanka, can you show my slide, please? Hello. Yes. Yes, full screen. Full screen. Okay, thank you. Sorry for the delay. This is due to some connection issue. Good morning, and thank you to the chair. And the paper which I'm going to present here is based on secondary information, that is on choices and participation of women in workforce in Delhi. I'm going to present the outline of my presentation. Is first I will just talk a brief about the background, and then about the Delhi's economy and what are the growth drivers. Then turns into how women participation in the labor force is emerging over the period, and who are the non-participants in the labor market, and then what are the opportunities and composition in the labor market for women, and then what are the opportunities which are emerging or employment generating sectors, and which are the issues which are hindering them. So these kind of things, and then finally the way forward. So as it is well documented that male participation in the labor force is an important driver and outcome of growth and development. It is well documented that greater participation of women in the labor market contributes to national GDP and growth at macro level. And at individual household level, who participates in the household or in the labor market have higher financial independence, better control over their own lives. They stand more against physical and emotional abuse, and also handle social issues, and families of such women also enjoy higher quality of living due to the additional income. However, the female participation in the labor force varies considerably across the developing countries and emerging economies, and far more in the case of men, like in South Asia, Asian region, and that includes India. In India, besides low participation rate of women, there is a huge gender gap, where only 2 out of 10 adult women are participating in labor market compared to 7 out of 10 adult men. Their participation over the period, if you see the recent period, is also declining, but this decline is in the recent years mainly attributed to rural women, while women participation in labor force in urban area is either stable or rising in some states or UTs. The government and policy makers and scholars in India have shown a widespread interest in and concern about this important issue for the last several decades. In particular, understanding women's choice to participate in the labor market, as well as the factors that can encourage them to either participate in or opt out from the labor force, is an important issue. This paper focuses on this issue and explores choices and participation of women in labor force in NCT Delhi. And the analysis is largely based on secondary information, that is employment survey and PLFS. And this covers only the adult female. How Delhi economy is doing and what are its growth drivers, it's important to understand before coming to the women's participation in the labor market. As for Census of India, Delhi is almost totally urban, which is more than 3 times higher than all India average. Delhi ranks second among all Indian states in terms of per capita income in real terms, which is more than 2.5 times higher than the national average. GSDP of Delhi at constant prices shows an annual average growth of 8% during the last year, which is 1.4% higher than all India average. And the annual growth rate of also per capita income is also substantially higher than the national average. As evident in urbanized states, the service sector contributes the largest share in GDP in Delhi. Retail dominates the services sector. 2 major contributing subsectors are real estate, owner of dwellings and professional services, transport, storage, and communication, that covers digital economy as well. However, the share of manufacturing has been significant after the surge in 1980s and 90s. In particular, micro and small industries or enterprises in Delhi have large presence in garment, furniture, electrical machinery, repair industries, and many others that attracts low-skilled migrants from neighboring states, where skilled workers of Delhi also commute to places like Gurgaon, Noida, thereby creating strong economic bonds between Delhi and other neighboring states. So how the growth rate and per capita income of Delhi NCT is inclusive, or how gender are able, or female are able to participate in the vibrant economy, needs further examination. So now, next. First, we try to understand how adult women are participating in labor force and how it changes over the years. As we can see, unlike India, overall LFPR and WPR in Delhi is almost stable during the last 2 decades. And adult male WPR declines, whereas male WPR rises, particularly in the recent decade. Female has very low LFPR and WPR. Only 2 out of 10 adult females are participating in the labor force, labor market, which stands at 5th lowest among all the major states in India. Historically, urban WPR and always high, always low due to high employment, rural WPR and LFPR compared to urban is always high just because of agriculture, where large number of women in this, but this is not the case in urban area, like the urbanized state of Delhi. There is a huge gender gap in LFPR and WPR. One can see the male participation in labor force is almost more than 4 times higher than the female counterparts. However, in recent years, the gender gap is narrowing, but at a slower pace. So we have talked about how the participation rate is going or stable or rising over the period. But who are the non-participants? How the non-participants in Delhi, that who are willing to participate but not able to participate in the work? So that comes from the difference between those who are willing to participate and those who are not able to get the job. So you can see the overall unemployment rate, open unemployment rate, which has increased over the period from 7% to 10%, particularly in the recent period, 2012 to 2019, the male unemployment has open unemployment has rapidly gone up. Further, the youth unemployment, which is, I think, our previous speakers in the introductory section already highlighted, like the youth unemployment rate is comparatively high, obviously in the overall in the country, but in Delhi it is higher than the overall average, and among females more than the males. As argued in the recent period, it is mainly because of demonetization, GST, which resulted loss of large number of informal sector jobs, and even the loss of jobs in other sectors. Particularly those who are highly educated, graduate and above or secondary and above, their unemployment rate is almost 3.4 times higher than those than the overall, and then graduate is 4.7 times higher. So it is also observed that WPR for women was high at both low level of education and high level of education. At low level of education or no education, women are compelled to work to overcome economic constraint. As education level rises, social and cultural constraint become weaker to drive the women outside the labor market. There is also reluctance to take up low quality jobs with higher level of education. That is reflecting in the higher unemployment rate of particularly the graduates or secondary and above educated females. Next. We have been talking about for the last several decades. There are many structural issues and other factors which are restricting women to participate in the labor market. I'm not going into detail, but these are some of the factors which I think in the literature also highlighted. Like these are drivers which these includes attending higher education or enrollment in higher education, rising domestic work burden, and not enough job in the labor market, not enough suitable jobs particularly for the higher educated people because of their rising aspiration over the period, lack of flexible or part-time work. There are many women revealed in previous surveys that they are preferring full-time and part-time work, those who engaged in domestic work, but that kind of part-time or flexible work is not available in the labor market. So there are restrictions, there are implementation problem of several government regulations as highlighted in the introductory session. And also one of the things like Maternity Benefit Act of 26 weeks paid discourages many employers to hire women in this sector. And safety and security is another issue which is also prominently comes out in several surveys. There are many other factors such as income effect and other also discussed widely in the literature. So if you see over the period, the adult women, those who are non-worker, those who are attending domestic work, their share has increased over the period. However, this is not reflecting in attending education, which are almost stable over the years. So there are another category which is emerging, which is overlapping category and which is emerging, and that is called NEET category, not in employment, not in education, and not in training. So around 6 out of 10 adult female, youth female are into NEET category. The share of youth female into NEET category is not only high, but also stable for the last 1.5 decades. As high NEET rate may be the reflection of significant displacement of young female, a high NEET rate of young women suggests their engagement in household force and the presence of strong institutional structure barrier, as discussed in the previous slides, limiting their participation in the market. So what are the opportunities? How the composition is? I think this is also important to understand. When we see the status of the employment, almost 3/4 of the adult women in Delhi were engaged in regular salaried employment.
I think you need to, one second, yeah. I think you need to move the slides, right? We're still at
okay.
much earlier slide.
Yes. I think
so, because the NEET category, nobody understood because the slide was not there.
Okay. Next.
What is NEET? Non-participation?
Not in education, not in employment, not in education, and not in training. So these are the people who are not in NEET. Okay. I think.
Okay. Please go ahead.
Yeah.
Please go ahead.
Yeah. Please go to next slide. Yes. As I said, employment opportunities, the quality of employment. So here, if you see the status of employment, almost 3/4 of the adult women in Delhi were engaged in regular salaried employment in 2019, and followed by 1/4 in self-employment, just 1% in casual work. Under the self-employment, a large part of the women are engaged in on-account work as well, as discussed in previous presentation, and only 1% are the employer and 2% involved in unpaid. So that is really interesting to see. Over the years, the share of female in regular employment had increased from 61% in 2000 to 74% in 19, while the self-employment declined from 35% to 25%, and casual labor from 4% to 1% during this. Overall, this is considered a positive sign when we compare the quality of employment with casual or self-employment category. But when we further analyze, the majority of them were engaged either in informal work or informal sector. As 70% of them were engaged in informal worker, those without any social security benefit, and around 54% were engaged in informal or unorganized sector. So who are these regular female workers? But there are also, we have analyzed through the income level, or you can say the regular worker who, what is their income level, or what is the salary level. So that we can see from the kernel density estimates as given in the graph. So as the regular, if you see the regular female worker are concentrated lower paid regular jobs. But their concentration at mid-level salary job is higher in some activities, which is interesting and emerging in the recent year. Mainly, I think we'll discuss this in the next slide. Mainly because of, I think, higher participation in or increasing participation in modern services.
You have 5 minutes left. So
okay.
Make the most of it.
So this is the occupational distribution also reveals the same. The majority of them still engaged in low paid and low skill, and if you see 1/2 of the adults are involved in low skill and low paid unskilled worker. Low skilled such as housekeeping, restaurant services worker, personal care, shop salesperson, and travel attendant, and unskilled low paid occupations such as peon, helper, and constant labor. But over the period, the women presence in high and skilled occupation, particularly in education, health, and modern services, ICT and finance services rising. you can see high skilled 13% occupations such as college, university teaching profession, nursing professionals, and medium skills occupations such as information technology, modern health associate, school teacher, social worker, nursing professional, obviously increase has significantly in recent years compared to men. Further, the industries or sector of employment, which are the sectors or which are the industries where they are employed. There are four sectors: public administration, education, health and household activities, services, manufacturing, finance, banking and real estate, and trade and hotel and restaurant. These are the four sectors where almost all the 98% of the total adult women employed in Delhi. In the last 2 decade period, women's employment growth was significant in the modern services. Although their share in the overall employment is low, but their growth rate is very high, around 11% and 5.1% in the during the last decade. And obviously, their participation or their number has decreased in construction and agriculture related activities. So, which are the sectors which are generating employment during the last decade? So that is a big question. So that we have to see where are the opportunities based on. This analysis based on 2012-2019, and what we have analyzed is like 10,000 plus those sectors who have generated 10,000 plus additional employment, and their share is more than 2% on above in the overall employment. So if you see, there are some sectors which I think we already know, those who are female friendly sector, like the domestic sector, education, health, but there are sectors which are like information services and financial services. Those are the sectors which are really, their share is low, but these sectors are generating quite a significant number of employment during the last decade. So, but why I'm talking about this activities of household as employer of domestic personnel. Even in the recent survey we conducted in Delhi on beggars, people engaged in begging, a lot of women have lost their domestic work and forced and to engage in begging due to their loss of. So these are the sectors which are not providing, but like some of the sectors which I have here starred, like these are the sectors, some of the sectors which are not, which are providing decent employment. So the sector like, information services, financial services, education, health. So these are the important employment generator. If we provide,
I think you're running out of time now.
Okay. Just wrapping. And some of the other sectors which I think we can also discuss about the emerging gig economy and work from home provision by some service sectors, which also has a huge employment potential in the future. So there are huge possibilities of bringing many women in domestic duties, highly educated, unemployed, and need into productive career for providing suitable environment and work and life balance. Female participants have substantially augmented by providing relevant skills suitable for emerging job opportunity in modern services, provide incentive and cheap credit and tax benefits to the employer or enterprise, having additional women, promoting women-owned small enterprises, although it is still very low, even after initiating a lot of schemes, and expand social security benefits and recognize as worker those who engage in formal sector employment such as domestic worker and gig worker, street vendor, and others. Appropriate law and regulations provide decent working conditions, increase household work sharing, effective enforcement of existing laws, regulations, schemes relevant for the females. Thank you. Thank you, ma'am.
Thank you. Thank you very much, and for a good analysis of the existing secondary data. I actually had two things I wanted to say based on your very detailed presentation. One was that, and this is my belief, that I think we should begin to challenge the data that we are using. I will give you one example. There's a very interesting study by Dr. Ravindran on the NSS data, where he has disaggregated Delhi, especially for Delhi, by different trades. So domestic workers, construction workers, home-based workers, etc. The number of domestic workers in Delhi that the NSS is giving us is, in my understanding, at least for Seva, the number of domestic workers is less than our own membership. So there is definitely an undercounting. And I think we do need a lot of micro studies to challenge this. We too easily accept, oh, NSS is telling us that means it must be true. It's not true. So I really do want to keep making that point that, we are here on the ground, we can do micro studies, we can show up that, some of these data is incorrect. So I think we should do that. The second point I want to make is that I thought it was very interesting what you pointed out about the high unemployment among females and males also, especially the educated. And this is a very strong emerging phenomenon. And this is one area where we really need to concentrate. How can you get all these young girls and boys also who have studied 10th class, 12th class into the work market, because they're ready to come. That's why they are showing themselves as unemployed. So I think your pointing that out is a very important issue. Of course, other important issues also, but I think it's time I moved on to the next speaker, who is Swati Datta. Can I ask you to make your presentation?
Yeah, sure. Good afternoon. Yeah, first two paper talks about unpaid care work and work opportunities of the female in the context of Delhi. But in this paper, I am looking into what is the women's aspiration, the women who are actually in the higher education, what is their aspiration to become entrepreneurs in the future, and what is their attitude and how far it is different from their male counterpart. So the title of my paper is Who Wants to Become an Entrepreneur? A Gender-Based Analysis. Entrepreneurship has long been the catalyst for economic growth and change. The importance and contribution of entrepreneurship to economic development is a popular research domain in academic circles. As in most other fields, in the domain entrepreneurship, also gender inequalities exist. The Global Entrepreneurship Monitor Report on Women and Entrepreneurship examined the rates of entrepreneurship in the 43 countries and showed that in all these countries, the rates of women's entrepreneurship were lower than men's. India also ranked low in terms of encouraging entrepreneurship among educated and the research and the training institutions. Why it is not moving?
You're not able to change your slides?
Yeah.
Swati, you continue. I'll pick up the slides from here.
Okay, okay, yeah.
You kindly continue. I'll open. Give me some time. You please continue with.
Yeah. Women face a range of cultural, financial, and legal barriers to their ability to start and grow business. Women in the region are also more vulnerable to poverty than men, not simply because they have lower incomes, but also because they are ability to access economic opportunity is constrained by discriminatory attitudes and restrict their mobility, limit employment choices, and hinder control over assets. The formal labor market in India currently saturated and unable to absorb ever-increasing number of labor force. On the other hand, there is also a number of educated unemployed youth in the country, and it is also a serious issue. So there is a need to assess the attitudes and perception towards entrepreneurship among students in the higher education institutions. An entrepreneur is an entrepreneur, yet the differences between male and female entrepreneurs provide compelling reason to inquire into the struggles, challenges, and aspirations of current women entrepreneurs in India. So in this context, it is an interesting scope for examining the gender differences in the attitude towards entrepreneurship and dimension among the current college or university going student. In this background, the objectives of my study is to assess the attitudes and perceptions towards entrepreneurship among youth in the higher education institutions, to assess the gender dimensions related to entrepreneurial institutions among final year students from graduate and post-graduation, technical and non-technical courses across public and private institutions in the National Capital Region, and to find out the relation between personality traits and gender gap in choosing entrepreneurship as a career option among the educated youth. So coming to the data and sample structure, the survey was undertaken in 2016-17 in Delhi. It covered 28 educational institutions. We covered both public and private and technical and non-technical institutions. We covered both male and female students of the same batch. And unless the institution is only for women and where they were surveyed in hostels, we covered both male and female from the same batch. And we covered both colleges and university students from technical. For technical courses, we covered BTech and MTech, and it is only limited to electronics and computer sciences. And non-technical courses, we cover BCom, BBA, BB, MBA. To understand attitudes, motivation, and challenges facing them to consider entrepreneurship as a career option. Next slide, please. We covered total 940 students, which covered 504 male and 436 female. Out of 940, we have 570 public institutions, 570 students from public institutions, and 370 students from private institutions. And out of 570 students, we have 336 male who are pursuing their study in public institutions, and 234 female from the public institutions, and 168 male pursuing from private institutions, and 202 female from private institutions. We have also covered graduate students and post-graduation students, and technical courses and non-technical courses, and their sampling structure is given here. Next slide. Yeah, coming to the methodology part, I have mentioned about that here. The objective is to see whether the both male and female students, what is their attitude to become entrepreneurs in the future. So we have tried to construct some individual entrepreneur attitude score, which is actually the consist of 8 items: autonomy, general self-efficacy, innovativeness, locus of control, optimism, proactiveness, competitiveness, and risk tolerance. And these items are measured in a 5-point scale. So basically we have given them some statements and asked them to rate whether they strongly agree with that or strongly disagree. So we have 8 items and 5-point scale. So our total IS score is the unweighted sum of all the scores of all the indicators, and it is the minimum value is 8 and maximum value can be 40. And higher the sum score, the higher the individual entrepreneur's attitude. Next slide, please. And this is the general definition. I am not going in details of that. So autonomy, general self-efficacy, innovativeness, internal versus external locus of control, optimism, competitiveness, and risk-taking and proactiveness. Next slide, please. Now, to understand who wanted to become entrepreneurs, we make a Probit model. So to quantify the so our dependent variable is the 10 variable, that is if she wanted to become entrepreneurs, then variable takes 1, otherwise 0. And we have several explanatory variables like age of the respondents, father's occupation, father's education, dummy for whether there is any entrepreneurs in the family, household monthly income, dummy for whether pursuing degree course or post-graduation course, whether pursuing in public institution or private institutions, whether pursuing technical course or non-technical courses, and whether institute has separate courses on entrepreneurship. Now coming to our main results parts. So basically our majority of the respondents were in the age group of 18 to 23, and some of the respondents were pursuing their higher education after having their job experience. So 10% of the respondents were in the age group of 30 to 35 years, and mostly they belong to general caste and mostly belong to family having graduate and postgraduate degree of other. Like this. Students mostly belong to business family or government job holders, and more than 1/3 of the respondents came from the affluent family with more than 1 lakh income, monthly income, and another 33% belong to the family with monthly income 50,000 to 1 lakh. Next slide, please. Yeah. Now, when we ask about what is their career work planning, more than half of the respondents wanted to look for salaried job after completion of their present education. And looking for salaried job is much higher for the male students compared to their female counterpart. Looking for salaried job is also higher for the postgraduate student compared to the graduate students. Interest to study further was higher among the female and graduate respondents. Now, when we ask them whether they wanted to become entrepreneurs only for their current study, then only 5.3% have told they wanted to become entrepreneurs, and there is some kind of gender gap. But when we ask them what about their long-term aspiration, come to next slide, please. Yeah. So when we ask them what is their aspiration to become entrepreneurs within 5 to 10 years down the line after finishing their present education, so then they told 62% of the respondents wanted to take entrepreneurship as a career option at any point of the time. Entrepreneur as a career option is also high among the female. Higher among the respondents from the private institutions compared to the public institutions wanted to become entrepreneurs. However, persons with technical degree are more likely to get placed and find jobs since their employability is perhaps better. So they are likely to become entrepreneurs is less than non-technical students who are pursuing non-technical courses. Next slide, please. Now we have constructed this IS score for both male and female students. We can see the average IS score of women is lower than the average IS score of male. As compared to men, women are overrepresented in the lower IS score categories and underrepresented in the higher IS scores categories. And women had a slightly lower inclination to become an entrepreneur because they have a lower IS score, at least on the basis of their attitude score. Now, when we look into the gender-wise mean difference about these 8 items, we can see mean score of the female respondents was lower than male respondents except for the proactiveness. The gender mean difference is highest for internal versus locus of control. That indicates the women students felt less in control of their life choices than the male student. Come to the next slide. We have also looked into the gender differences in terms of whether students are pursuing in the public and private institutions. 3 significant results we find: female students had higher mean score for proactiveness, general optimism, and competitiveness in the private institution than their male. That because students in the private institutions perhaps comes from upper classes and the girls are equally encouraged and motivated as the boys. unlike students from the average income backgrounds in the public institutions. Now, when we ask them about why they wanted to become entrepreneurs, we find very interesting findings. So important factors we find: create something innovative, focus on technology that interests you and satisfy our need of market. That is the general findings we found. But there is our gender-wise differences. For male counterpart, they have identified technology that interests them, followed by satisfy the need of market and create something innovative and to realize their own dream. But for female, it is actually the having more free time, followed by having more flexibility and independence and create something innovative. So that motivates the females to become entrepreneurs. We have also asked them about the obstacles. So if they wanted to become entrepreneurs in the future, what are the obstacles they faced? So here major obstacles they find: difficulty in obtaining bank finance, followed by lack of business skill, lack of family support, lack of business experience are the major obstacles. For the male counterpart, it is identified as lack of savings, future uncertainty, target market, and market size. However, in case of female, we find difficulty in obtaining bank finance, lack of business skills, and lack of business experience. So finance is one of the major problems for female to obtaining the loan for start up their business. Now, who wants to become entrepreneurs? From the probability model, we find for women, the estimated probability is about 11 percentage point lower as compared to men to choose entrepreneurship as a career option, holding the other variable constant. But when we include the IA score, we find even if they are female and if their IA score is higher, then their decrease of this negative effect to become entrepreneur is increased. So if the IA score is higher, then female can also become entrepreneurs. And positive relationship between IA and who want to become entrepreneurship as a career also strong positive relationship between IA and male as well as female to choose entrepreneur as a career option. And household level income has an impact on monetary resources as household can contribute to an entrepreneur startup. Middle income bracket respondents' willingness to become entrepreneurs decline, whereas for upper income, it increases. Next slide, please. With graduation and professional degree tends to increase the willingness to become entrepreneurs for male respondent. On the other hand, only professional degree of fathers increases the willingness to become an entrepreneur for female respondent. Father with business generally influence the willingness to become an entrepreneur for both male and female respondents. Entrepreneurs in the family increase the willingness to become entrepreneurs for female respondents. Studying in private institution and non-technical courses tend to increase the willingness to become entrepreneurs for female respondents. If institute has a separate courses on entrepreneurs, also influence willingness to become entrepreneurs, but significance level is high for female respondents. For female respondent, effect of proactiveness and competitiveness is more significant than their male counterpart. Next slide, please. Next slide, please. We are not continuing this. So we also wanted to see whether what explains this gender gap. So we can see this almost 39% of the gender difference is not explained within the model. Actually, that can be explained by some other unobserved skill, that is government policy, skills, institutions, which actually can help to reduce the gender gap between male and female. Come to the next slide. Yeah, coming to the conclusion plot. In this paper, we basically talks about women students aspiring to become entrepreneurs in the future and what are the factors behind them. Overall, most of the students express their interest to take up entrepreneurship as a career, irrespective of female or male. However, students from upper income class households were more likely to aspire to become entrepreneurs. Students from entrepreneurial families whose parents were in business were more inclined to become entrepreneurs, and this being more significant among women students. Students in public colleges were more likely to aspire to be entrepreneurs. Gender difference in personality trait in public colleges was larger with male students, more likely to be risk takers, have control on life decisions, general optimism, competitiveness, and were innovative compared to female students. Next slide, please. Gender did not matter in private college in terms of aspiration to be an entrepreneur. Students in private elite colleges came from upper class houses where girls were equally motivated as were boys. College offering separate courses on entrepreneurship positively influenced willingness to become entrepreneurs, both male and female. Effect of proactiveness and competitiveness was significant for female students compared to male students. And students also articulated the need for some of education and training in entrepreneurs, and it is more among the women students. Business development stood out as the main factor motivating entrepreneurship for males, while independence figured as the main motivating factor for the females. Thank you.
Thank you. Thank you very much. That was really very interesting. And I think there are very few studies like this which actually look at the entrepreneurship aspect. And what is positively surprising is the large numbers who want to become entrepreneurs after some years. I'm just wondering how much of that will actually translate, but even if it doesn't, it's actually a very interesting finding. And I was wondering how we could motivate that more through what actions that can be motivated more. I think now we will go to the panelists. And we've had 3 very interesting presentations. So I'll just go straight to Dr. Radhika Kapoor. I think we have 10 minutes for each panelist. So I hope that's enough.
Thank you, Pam. Thank you, IHD, IST, for inviting me to be a discussant to these papers, all 3 very interesting papers. I'd like to apologize in advance if my comments are a bit scattered and all over the place because I've just taken notes down as the speaker spoke. So with that caution, I'll start. So let me first start with Dr. Mehta's paper on choice and participation of women in the workforce in Delhi, because that lays out the stylized facts vis-a-vis the labor market in Delhi. And it had some very interesting findings where basically you're showing that the worker population ratio for women has been rising, which is a good thing. You're also showing that the distribution of employment by employment type is improving, because the paper tells us that the share of women who are engaged in regular salaried work has increased. And in fact, that is higher than the share of men in regular wage salaried work. And that was, I mean, if I got all those numbers right, I think that was a very significant finding. But what was disturbing was that when you actually looked at where even these regular salaried workers were employed, they were still largely engaged in the informal sector. And also what you said was that the percentage of women who didn't have access to social security benefits was still very high. So I was wondering, I mean, are you talking about regular wage salaried women who are in the formal sector but don't have access to social security benefits? So in other words, are you talking about regular informal workers in the formal sector? Is that share actually increasing for women? And the reason I ask that is because, there is, as Professor Geeta Sen mentioned in her keynote, and a number of other speakers have said, there is increasing informalization and casualization of the workforce, which is happening within the formal sector. Now, the ASI data, which is of course restricted largely to manufacturing, over there you don't get gender disaggregated data vis-a-vis contract workers. So you can't say much about whether it is men or women which are being hired more as contract workers. But in the NSS, you can do that. So is it the case that women are witnessing more? They might be being employed in the formal sector, but they're witnessing more informalization or casualization because they're not getting access to social security benefits. And the reason I also ask this question is because, the NSS has, in the PLFS, there is a nice set of questions on access to social security benefits, one of which is maternity benefits. And we know that maternity leave has been increased to 6 months. So now do policies like this actually disincentivize employers from hiring women in regular formal jobs? So that decomposition is important, because again, when you do this sectoral breakdown, and you said that basically women were largely employed in 4 industries. There was public administration, education, health, and so on. There's manufacturing, finance, banking, and real estate, trade, hotels, and restaurants. It's important for us to understand that within these sectors, where are these women employed? Are they in the organized sector? Are they in the unorganized sector? And if they're in the organized sector, are they actually being hired as formal workers or as informal workers? That would be a nice addition to the paper, in my opinion, because you're laying emphasis on the quality of employment. And that's what we want to actually highlight, because economic empowerment for women is not simply about creating more paid work, but the quality of the work is very important. The other thing I was interested in was that, again, you show that more than half of the women are actually engaged in very low skill service occupations. And then the rest of them are actually in very high skilled occupations. So I'm guessing that on top of the disparities that are there on account of gender, there are also disparities on account of education. And so while there are women who are educated, who are able to access better opportunities in the labor market, those who are less educated and come from socially marginalized backgrounds, they actually don't have access to quality employment opportunities. So addressing those barriers to education actually becomes important, so that we don't perpetuate gender inequalities into the future. So those were, broadly my comments here. Also, you showed this nice graph on wages. I think, again, it would be nice to see how this varied across the 4 sectors that you were talking about. What is, the wage disparity for men and women in these sectors? And is it the case that on average wages are lower in the sectors which hire more women? Because, there is evidence to suggest that happens. So vis-a-vis Delhi and the sectors that you point out, I think it would be interesting to see those things, because the quality of employment will essentially be a function of whether they had access to social security benefits, whether they had certain security vis-a-vis their contract, meaning was it a written contract? What was the duration of that written contract? And also their earning levels. So I think it would be important to understand these 3 dimensions to get a better sense of the quality of employment that we are creating for women. And also you mentioned, the sectors. I mean, within manufacturing, a lot of women in Delhi are likely to be engaged in sectors like textiles, leather garments. I was just wondering that, given that the government introduced fixed term contracts, which basically allow employers to have flexibility vis-a-vis termination of contracts, there are no retrenchment costs, but at the same time, workers are provided the same social security benefits that a permanent worker is. Do you actually see any evidence of women being hired as fixed-term contract workers in the data, or is that not possible? Or if not in the data, I'm not sure if you're going to be able to do that with the PLFS, but are there any other surveys that you're doing which suggest that there's actually been a take-up of fixed-term contracts for hiring women in some of these labor-intensive manufacturing sectors? So those were broadly my comments on the first paper. Then, the next one by Dr. Banerjee on understanding care work as a barrier to economic empowerment of women, informal workers in Delhi was really quite interesting, because you go into it believing that majority of women are actually opting for informal work. They're choosing to be in informal work because that work gives them the flexibility to accommodate their household chores, the burden of unpaid care work. And this paper is actually asking the question that to what extent does care work, that the burden of care work, act as a barrier to economic empowerment of women in informal workers. So I think this was a really interesting paper, and your findings were also really quite interesting. And in terms of the policy recommendations, I think that was really the key takeaway of the paper for me, because it is not just about the women who are working that are not able to either be in the formal sector or concentrate their work even if they're in the informal sector, or do better things even in the informal sector, but also the fact that other members of their family, in particular older the older child, if it's a girl child in particular, they have to bear a significant burden of this. And all of this has adverse consequences for their health and education. And this again tells us that, if we're unable to address this challenge of providing, quality child care for these women, be it in the formal or the informal sector, it also hurts the prospects for the next generation, especially for the girl child, and once again perpetuating these gender inequalities. So I thought your findings were really quite interesting. And the final paper on entrepreneurship, I mean, firstly, I was really happy to see a paper on women entrepreneurship, because we don't have much research on the subject in India. Now, before jumping into the paper, just to sort of clarify, I mean, what do we mean by entrepreneurship? Because in the discourse, we just, especially when we're using this PLFS and NSS data and so on, we use the category of self-employed. And the self-employed accounts for own account workers, it has employers, and it has these unpaid family workers. And if you actually break down those numbers, while over 50% of India's workforce, be it men or women, are self-employed, a very small proportion of these are actually in the category of employers. So the entrepreneurs that you're referring to are basically the employers, because they are generating employment opportunities for others. So I think, what the data tells us is that there are very few people, they're largely own account workers. Very few of them are actually employers that are generating jobs for others. And for women, that number is actually really small. I think the last time I checked, it was less than 1% of women reported to be in the categories of employers, both in rural and urban areas. So therefore, what we are, when you're asking people about entrepreneurship, how do they view entrepreneurship? I mean, are we talking about these own account workers, or are we actually talking about these dynamic, risk-taking entrepreneurs who are generating employment opportunities for others? Because that's really quite a wide spectrum. The own account workers are, in a sense, enterprises which are just survivalist in nature. And a lot of people are doing this work because of lack of alternative job opportunities, because they cannot find good jobs elsewhere. So they are pushed into this because there isn't another choice. But the employers or the entrepreneurs are really the ones who are doing this out of choice because they want to do it. So I think having that distinction in terms of how people are perceiving entrepreneurship is important in the kind of work that you're doing. And it would be nice to have a clarification on that. But having said that, and the fact that even though there are very few, the share of women which fall in that category of employers is very small in India, it's also worth noting that a couple of years ago, when I looked at the NSS Unincorporated Enterprise Survey, which is basically the informal enterprises, if you look at enterprises that are headed by women, these typically hire more women. So in the larger scheme of things, I see a big role for women entrepreneurship in terms of creating better jobs for women, because the data at least seems to be suggesting that in the informal sector, that was the case. Now, again, you did this this index that you've created, which is really quite interesting. I'm not sure I captured all of this in your slides because it went a little fast and I hadn't got the slides before. But I think one of the things that needs to be borne in mind that when you're posing this question to men and women is that, okay, you ask them whether they wanted to be entrepreneurs, but what are the sectors that they want to be entrepreneurs in? Because very often women tend to be concentrated as entrepreneurs in sectors that are generally less profitable, or they would want to be in low-end services or traditionally lower value-added production. So therefore, when the gender decomposition there becomes important, looking at it sectorally, because that to a large extent determines to what extent what their future transition path is going to be, and how successful they will be in the future, or how profitable they will be, and so on. So I think, it would be nice if if that could in some way be incorporated in here. The other thing vis-a-vis entrepreneurship, now is you highlighted all these psychological factors, which I think were very important, because we have the usual list of lack of access to credit and training and so on and so forth. But the psychological factors are particularly important in the context of entrepreneurship, because women may have less confidence to take on these kind of things, or they're just less risk-taking in attitude. So they would not want to jump into, being an entrepreneur in general is a high-risk venture that could also impact, like I said, the sectors that they choose to be entrepreneurs in. But another dimension which might be worth exploring is the unequal power relations that are there. Women who are entrepreneurs, like you listed out the constraints that were faced both by men and women, but what was the degree of heterogeneity in the constraints which were faced by men and women? Because even if you say something like having access to credit, if a woman goes to a bank and asks for credit, she would probably have relatively lower bargaining power. Similarly, interacting with her vendors or her suppliers, if a woman is the face of the business, it might be more difficult because of a weaker bargaining position, or it could even be vis-a-vis your own staff, that handling some of this could be a challenge. So I think in the entrepreneurship space, where the woman is actually taking on a more powerful role and she's taking these decisions for her business, and she is the face of the business, the power theoretic framework actually becomes quite important over there. So, so yes, I think, broadly, those were my comments. And I just wanted to, add 2 bits to the question on data. Now, we've all been lamenting the fact that the NSS does a poor job of capturing women's work, and we're obviously underestimating women's participation. And the PLFS actually has a shorter questionnaire. The NSS, the earlier NSS quinquennial round actually had a longer questionnaire where we had more detailed questions on women's participation. Unfortunately, the PLFS has done away with that because it's an annual questionnaire, so they had to reduce the length of the questionnaire. So we've lost a lot of information there. But increasingly, a lot of research is moving in the direction of using the CMIE data. And here, actually, the women's participation, their female labor force participation rates are even lower than what you see in any NSS survey. So I think when we are starting to use the CMIE data much more to have, especially around labor issues, I think we need to think through more carefully about how women's work is being captured, because the way they frame their questions, it's really quite, it's a little vague. You're not really capturing any activity status of a person or understanding what are the various activities you're doing. You're essentially just asking them whether they were employed and whether they were unemployed, or were they unemployed looking for work, and so on. So I think having that CMIE data is adding to that. I mean, working with the CMIE data on gender issues is going to aggravate some of the challenges that we've been talking about. So I think with that, I'll stop. Thank you.
Thank you. That was very far-ranging. And I think you've raised a lot of questions that when we come back to the speakers or presenters, the only one thing I wanted to say is that why only the CMIE data, which is not really that good on employment? What about the IHDS data? Because there's a lot of very good data there, and it's panel data. So I just wanted to bring that in. I now turn to the next speaker. Do I see her? Farzana?
Yeah, I'm here.
Oh, there you are. Okay, great. Hi, welcome, and nice to see you again.
Yeah, nice to see you also, Rinana.
Yeah.
Thank you so much for having me. And I wanted to congratulate the organizers for doing an excellent job in terms of putting together the entire conference, and also having some very interesting papers which cover, I think, a wide spectrum of issues that we, have been grappling with when it comes to women's labor force participation. So what I'm going to do essentially is sort of think of, give you an idea of where I'm coming from and how I understand this issue, and then try to give some feedback to each of the papers that have been presented. I think the focus, as on the panel itself, as Rinana pointed out, of course, is on Delhi, but also on the level of women's labor force participation. as opposed to trends. So we did have one paper that was trying to address some of the issues related to trends. But what we are, sort of trying to look at over here is what are the factors that determine the levels of women's labor force participation and the constraints that they face. And I think the papers did an excellent job in terms of trying to understand both the demand side constraints as well as the supply side constraints. So very often in our discourse on women's labor force participation in India, the focus has been more on the supply side and very limited discussion of the demand side factors that constrain women's labor force participation. And the second thing is, of course, that we are focusing on an urban context where some of the issues that women face are quite different from rural areas. So these are, so that's something that we need to keep in context. And what I wanted to sort of point out over here is that it's important to look at both the supply side factors, which I think, we started off talking about in terms of norms around women's time allocation, the distribution of time within the house between the home production activities and care work that women undertake, or the expectations about the time that women undertake, as opposed to how much time men would be devoting, and as a result, the constraints that it imposes on women. But also on the demand side, when we talk about labor standards, the skills that women have, and therefore the kinds of jobs that are available to them, and essentially about labor market returns. So there are, if a woman did want to join the workforce, are the returns that are there in the labor market, are they commensurate or attractive enough for women to go out there and work? So let me first delve into, the paper that I think talked very well and very nicely. Ms. Banerjee's paper discussed the care work and the constraints that women face. And I think what is also interesting here is that we are looking at the entire spectrum of the education distribution, right? So the care work, the focus of this sample was on women who are less educated in informal work. They're pretty much destitute. So they don't have this option of not working because they need to work in order to subsist. So, and this takes us, to the literature, where we are very much aware of the U-shaped relationship between women's education in India and labor force participation. And we know that at lower levels of education, women's labor force participation tends to be higher, then it declines as women's education goes up, and then it increases again when we're looking at higher levels of education. So I think the paper brought out very well the constraints that women face. And when we talk about norms, I don't think that I would try to define it more broadly about what we mean by norms. And if we talk about the norm of the distribution of time within the household, in the sense that it is the responsibility of the woman to do the care work, to take care of all the cooking and the cleaning and so on and so forth, we are unable to sort of fight that. We need to fight that, of course. But given that constraint and that norm, that as a result of this norm, what is it that women are doing with that, right? And so when we're looking, women at this level of the income distribution do not have access to market services to be able to take care of home production activities. And therefore, they are going to turn to their children, to members within their family, to be able to substitute for the work that they have to do when they go out to work, because it is, they require that income. I think it would be very interesting if you could supplement some of the data with the time use data, particularly now, we have this new time use survey that has been collected for 2018. Of course, we have a very old one, which was in 1998. But now the new one that was collected also is very representative in the sense it's, covers all the states of India, would have more of, it will allow us to sort of disaggregate it by urban areas, to look at, and also probably by education, to see what, the constraints that women face, how much time they're allocating to this, to home production activities. So that was, and I think there was a question also asked on this, whether there is information available in your data set on time use. And there were two things that stood out here. One was the care work, and the other was when it comes to, fetching fuel, let's say, or cooking and water and so on and so forth. So I think that would be very helpful in terms of seeing what proportion of time women are spending on that, but also think more broadly in terms of public services that are available. So for example, when we talk about water, right? I think water is so essential, but in terms of sanitation services, tap water services, what is the status in the localities in which you are looking at, if there is any data on that? In addition, very often in these areas, women might not be using LPG, for instance, for cooking. They might be depending on solid fuels. Again, collection of that, and it also has adverse effects on their health. So what is the role of, the PMUY program and so on and so forth in terms of public programs which are available? There's been so much focus of the government on sanitation, drinking water, and cooking fuel. The other aspect of it is, what is the quality of the schools in these areas? So is it that women are not sending their children to these schools because they don't think that there is any return from sending them to these schools, and it is much better that they stay at home and take care of the younger siblings? Because if the quality of education again is very poor, then that's another reason why they may not just want to, because it's just a waste of time. You're better, the time of the older child is better used at home by taking care of younger siblings. And that is another public good which is poorly provided, other than just Anganwadi services also, where of course, one of the things that we've noticed, for instance, there was this study which was done in Bangladesh amongst garment factory workers, and they did a randomized control trial where they provided child daycare services to these women, and they found that the take-up was very low. So they were very surprised as to why the take-up was so low when you would expect that the demand would be very high. And one of the things that they noticed was that when, again, there might be some norm around what is the responsibility of the woman, that if it is the responsibility of the mother, and then there is a mother-in-law in the house who expects you to be the primary care provider, or somebody within the household being the primary care provider, then you may not want to use those market services or public services for that matter. And as you rightly pointed out, also the quality of these public services might be very poor. That is, a fundamental issue. So I think what really comes out from this study is that given that these women are so destitute, the public services and public programs may not be providing adequate support to them to be able to alleviate these constraints that they face in terms of the allocation of their time. And I think this is something that you should push through in your paper as a solution or a policy concern rather, right? The policy concern being that we are not able to do a good enough job in terms of, in spite of the fact that these programs exist, then why is it that they're not delivering? So I thought that was very well collected data, and it is extremely useful looking at this particular section of society. The second paper, which was presented by Mr. Mehta, I think again sort of moves us to looking at the entire distribution of education of women and where they are going in terms of the kinds of jobs that they are taking up, and very good use of the secondary data. I was a little bit puzzled by, I wouldn't say I was puzzled, but I would say that one would have to be a little bit careful in terms of drawing the conclusions from the descriptives that we are getting from the data, So as far as I understand, a lot of the descriptives were coming conditional on women working, right? So if I understand correctly, the fact that, for instance, you see a larger proportion of women are employed in the formal sector, and over time, there seems to be more of a trend towards going to the formal sector. What is happening? That's conditional on women joining the workforce. But who are the women who are joining? And who are the women who are not joining the workforce? We also need to understand those who might be looking for work, right? So unemployment rates, for example, amongst women might be going up because they want to work, but they're not finding the right kinds of jobs. So I think this is a paper which can do a tremendous amount of service to trying to understand the demand factors. So what are, how is the economy of Delhi changing, and is it able to accommodate the changing aspirations of women as women are getting more educated? Why is it that we are not seeing more of these educated women, women's labor force participation going up? What is happening with our manufacturing sector? What's happening with the formal sector, essentially? And I think, I would agree that there is an aspiration as women get more educated towards better jobs. We don't have enough discourse on good jobs, jobs which are provide safety, provide higher returns, maintain good labor standards at the workplace. So it would be very important to sort of correlate what is happening in terms of the trends in the structure of the economy in Delhi vis-a-vis the trends that we see in women's labor force participation. And that brings me then to, the last paper, which was presented by Ms. Datta, which was absolutely fascinating. I was really happy to see that paper in terms of, trying to understand, as I think Radhika mentioned earlier, and also Renana said, looking at an aspect which is not very well researched. And also then again, moving us to the higher education distribution of women's labor force participation. I had one question. I was actually puzzled by the fact that there were so many women, or a large proportion of the sample, which said that they were interested in becoming entrepreneurs. That also speaks to the question that Radhika raised, which is how was the survey framed in terms of what is the meaning of an entrepreneur. And the second is that there could be some bias in the response. So for example, very often as surveyors, when we go and ask questions, the respondent gives an answer which they think that the surveyor is looking for. So if I go to a respondent, to a person and say, do you want to become an entrepreneur, or we are running a study trying to understand, desire to be entrepreneurs, many of them might say, yeah, of course, we want to be. And then we don't know whether they're really interested in being entrepreneurs or not, or because it is this bias in terms of reporting. I thought that the study brought out really well the differences between men and women's aspirations, but also the constraints that they face. We know that a lot of women at the lower income level also might be entrepreneurs, but as rightly pointed out, they are petty, business owners and so on. We do not have the capacity to employ large number of workers, but and that we observe, of course, in Delhi, in many of the poor localities. What was interesting here was the difference that you saw between the private and the public institutions. And I was wondering whether you could dig in a little bit more into the family backgrounds in the public and the private, whether, of course, as you pointed out, it could be because the aspirations of the parents who send their kids to the private sector, private institutions might be very different from the public institutions. But we also know that there will be a distribution in terms of educational attainment of parents, in terms of their incomes. And also there could be, therefore, a difference in the capacity to be able to support children who might be want to be entrepreneurs. And that might vary, for example, also in terms of the gender gaps as well. I think this the fact that you found when you did your decomposition analysis that there's a significant proportion of the variation that is unexplained. I was wondering what your thoughts on that were in terms of whether there are these attitudinal factors in terms of women being entrepreneurs and being encouraged by their families. Again, as we're speaking about norms and some such factors, which are cultural factors, which might be constraining women. In addition to the fact that, getting access to credit, having the right institutional environment to be able to become successful entrepreneurs might be a challenge for these women. So I think these were a set of excellent papers. So I congratulate all the authors on the work that they've done, and I'll stop here. Thank you.
Thank you so much. And now we go on to Ms. Sunita Sanghi. Nice to see you.
Thank you, ma'am.
And we hope to hear something from your experience, your response to these three papers.
Thank you. Let me at the outset thank both IHT and ISST for giving me this opportunity. And I think I must compliment all the three authors, because the issues that they have raised and they have explored and they have looked into, researched, they are very close to the policy. Because since I'm coming from the policy side, I know that all these three issues, when I was at Niti Aayog, I was at Ministry of Skill Development. At both the places, I was looking at, especially at Niti Aayog, looking at why there is a falling female labor force participation, especially in the urban educated women, number one. And also how we can encourage more and more women to be an entrepreneur. And in terms of what Ms. Monica has presented about the care work, that was also an issue which we were discussing with the Ministry of Women and Child Development in my last assignment in the Ministry of Skill Development, because there the minister has been wanting that we must focus on these these women who are from the lowest of the pyramid. They have no facility, no social security. So we must provide them some kind of a training capacity building, so that instead of going for the paid employment like this, if they can do some kind of a work sitting at home so that they can fulfill both the responsibility. Now, coming to Dr. Balwant's paper, I think it's a very good analysis what Radhika and I think Professor Farjana has already covered most of the issues and points. But what is really good to note in this particular paper is that there is a change today that is coming out from the paper, the secondary data, that now more and more women are moving away from the traditional kind of a job role, and they are now going into more non-traditional kind of a job role. But what is also very surprising is in what Dr. Fazana was talking about, that we are looking at the kind of a structure that the Delhi economy is. There are a lot of infrastructural activity which have been undertaken by the Delhi government, and seeing there that the proportion of women in the construction sector going down. I mean, that's really a little puzzling as to what has happened and why, because otherwise, when you look at the data right from 1999, there has been a huge increase in those who are working in the construction sector. In fact, construction has been one sector which has been providing large employment opportunities to both men and women, whether from rural or the urban areas. So I just thought that that is one factor that needs to be looked into as to why there is a decline in the construction sector participation as far as the women is concerned. And in terms of the gender disadvantage that Professor Mehta has talked about, I think it's a very universal phenomenon. And what Radhika has talked about, that we need to look into the wage differential. Because for the same work, whether it's a rural area or the urban area, the women are being discriminated against, in spite of the fact that there are Equal Remuneration Act, there are Minimum Wages Act. So I think the paper need to look into how well these two regulations, whether it's the Equal Remuneration Act and the Minimum Wages Act, have been implemented or not implemented. That needs to be looked into. And we also, I think, need to look into as to why there is a decline in the male labor force participation rate vis-a-vis the female. Is it because the male are not finding the jobs very, very suitable, or Is it because the more and more women are moving out and getting the taking those opportunities? Another important issue that Dr. Mehta has raised about is a U-shaped curve in the unemployment rate for the educated women. In Niti Aayog, I think we did a study in 2015 using the NSSO data, and our analysis was that while what Radhika had also pointed out, or I think one of the paper pointed out about the NEET category, the women may not be in the education space or in the employment space, and especially in the urban areas, they may not be in the employment, not because the opportunities are not there, but perhaps because their families can support them and they can wait for better opportunities to be there. So they are wanting to be unemployed. They are not taking up the opportunities that are there. So this is what one of our study had pointed out, that women in the urban areas are, especially those who are highly educated, are unemployed because they are waiting for the best opportunities and their families are willing to support them. So I think if you are able to look into the wage differential and also look into the specific reasons for decline in the casual wages and increase in the regular wage employment, if you can just look into as to why this has happened. So that will enrich your paper, and also how well the various regulations which are protecting the women's right, women work, if you can just look into. Because I was just wondering in Monica Banerjee's paper when she talked about, and I think Dr. Fajana has also talked about time use survey and other things, we talk about that there is childcare facilities are not available. As per the Factories Act and as per other acts, it is mandatory for any institution if the waste pickers, especially you were mentioning about the waste pickers, if they are working for a particular employer who may be employing more than 30, so it is necessary for them to make available the childcare crèche facility for them. I think a couple of years ago, that was sometime in 2016-17, Ministry of Labor and Employment was thinking about, especially for the construction worker children, the residential schools or the construction sites, because they realized that perhaps the children, because mothers and both the parents are working at the construction site and they're not able to take care of the children studies are suffering. So they have been thinking about that there needs to be residential school near the construction site and near such employment where women has to necessarily take the children, so that children education and health does not suffer. I think your paper can look into that, whether it's possible to do that or it's not possible to do that, because that was one of the thought process when we were looking into the construction worker activities and Building and Construction Workers Act, Building and Construction Worker Acts. The third paper on the entrepreneurship, I think that's a very interesting paper, and as both Dr. Fazana and Dr. Radhika has talked about, that it's really throwing very good, and for the first time, some analysis has been done that women needs to be an entrepreneur. They have shown their aspirations. But I think what Radhika has talked about, that we need to make a clear distinction between and define the word entrepreneur. Because today also we have large number of women who are self-employed and they call themselves an entrepreneur. So we really need to make a distinction between a self-employed person and an entrepreneur. But it's a very well researched paper. And I couldn't follow your index much because I didn't pay much, let me put it very frankly, but I think it's a very interesting paper. But what you need to look into is there are multiple policies which government has undertaken, both from the Ministry of Women and Child Development as also from the DIPP side, who are looking into and strengthening the women entrepreneurship. I think you need to include those policy prescriptions as well. And there are multiple initiatives that have been taken by the government to ensure that there are capacity building in terms of skill development. There is credit availability. I think your paper also need to look into the kind of policies that the government has taken to promote the entrepreneurship in general, and especially the women entrepreneurship. I'll just quote here one of the examples which Ministry of Women and Child Development has undertaken to promote the women entrepreneurship. What they have done is they have initiated what they call an e-heart. So any women entrepreneur, because marketing is also a big challenge when it comes to the women entrepreneur. So what they have started an e-heart, and they are close to about, I think, 7,000 products which are already there on the e-heart. So women doesn't have to worry about selling their product. The ready-made market, e-market is already available. And when you look into the program like Mudra Yojana, I think that also you can include and see how well it is impacting the women entrepreneur. Because you are talking about the college students. I visited and I gave a couple of lectures in a couple of colleges here in Delhi. And I was really surprised to know that large number of students were not aware about the kind of policy prescription, policy measures that government has undertaken. Related to, I think this is very important, is a career counseling. And I have been working on the career counseling and career guidance aspect, which is, I think, relevant for all the three papers that have been presented here, because career counseling and career guidance has not been given any place so far. Whether it is in the school education or whether it is in the college education, asking a student that you want to be an entrepreneur, he needs to understand what an entrepreneur, what are the challenges that he has to face and how well those challenges can be addressed through the policy measures that the government has undertaken. I think if your paper can address and can include the policies that the government has already undertaken, that will really help those who are actually wanting to be entrepreneur. And Monica, for you also, I would just like to indicate when you're talking about what Radhika and Farjana has talked about, that you need to look into the time use survey that NSSO in the PLFS is doing. And Dr. Jhabawala has rightly said that the NSSO data is a little underestimated, because when I was working on 2018-19 PLFS, the first PLFS survey, we realized that the population was 30% underestimated. So if your total population is underestimated, your all parameters are going to be underestimated. So I think all of you need to look into the government policies as well, because many of the policies are addressing the challenges and issues that you are posing in your papers as well. So those that can enrich your papers as well. Thank you.
Thank you so much. And I think the panelists have raised really, really interesting questions and issues. And we have like 15 minutes left. So I'm going to ask each presenter to answer them, or not to answer, but you've been listening to what the panelists have been saying about your papers. So if there is, I'm sure you'd like to engage with what they said. There are not many questions that are left. I can see most questions have been answered. The only question left really is, why is there a move away from agriculture and construction? I think for Balwant Mehta, but I'll quickly give my answer to that. The move away from agriculture in Delhi is because Delhi has expanded to the urban part of Delhi has expanded and taken away a lot of the farmland. And the decline in construction is something we have been seeing. And this is a very interesting, there's no decline in construction overall, construction workers overall, but women has drastically declined, because many of the projects now are formalized projects by big companies. And when you have formalized projects by big companies, they only hire men. So earlier, you used to see women construction workers around in Delhi. Now you only see men in those hats, and mostly with mechanized construction. So as we move from informal to formal construction, the women are removed and it's the men who take over. So anyway, that's my answer, but the question was actually for Balwant Mehta. We have 5 minutes for each panelist. So please, if you, for each presenter. So if you don't mind, because I will disappear at 1:30.
May I start?
Who's that?
Monica, may I start?
Yes, I was going to ask you to start.
Thank you. Thank you very much, Radhika, Farzana, and Sunita ji, for your very kind comments, and also, the other participants who have, raised some very pertinent questions. I have tried answering to them to the best of my ability. But if there are any other queries, please do feel free to write in. I just wanted to say that the idea of this paper was, and the idea of collecting this data was to the larger objective is to say that childcare has to be seen from a gendered and a rights-based perspective. The problem with majority of there are several, and I know Sunita ji has raised a very important thing, that skilling is an important aspect, and absolutely, as Farzana said, that the demand side, where women, where are women really going? One of the aspect apart from care work is also that they consider themselves very, very unskilled. Renana just pointed out that in construction work, women are decreasing. One of the reasons is that the kind of work women do in construction is considered unskilled work. It's support work, and hence big machines are now available, and so why should employers and the contractors should really hire women when they can have machines, which is one-time investment, and they can really work with that, whereas with women they have to have several other things apart from the daily wages that the women have to be provided. So there are always these side issues there, and hence skilling would definitely help. But also the fact is that, until and unless care work, the unpaid care work is seen as definitely, from a rights-based perspective and seen as a need of women as much as the child, things will not change very drastically. So I think the government also needs to have see care work and care facility, care centers as a need for women. And one of the ways is probably a convergence. Right now, ICDS is under, MWCD, and women workers are under the Labor Department. How will the Labor Department ever know what is about the, care problems of the women? So I think there is a requirement of certain amount of convergence and certain amount of understanding and a rights-based understanding of women's work, unpaid care work that women have to do. I'll stop here and give others a chance. Thank you.
Thank you so much. Shall we ask Balwant Mehta?
Yes. The first question, and thank you all the panelists.
Can you put your video on, or is that difficult?
Okay. Just a minute. Don't know.
You're on. Clear.
Yeah. Okay. Fine. Actually, all the questions are very interesting, and some of the things I think we cannot cover all the things in paper. This is a very, I think, I've just made this paper in the last 1 week only, so I'm not able to cover all the aspects. But thank you very much, and I will obviously incorporate most of the comments which I've given by the panelists. And one of the things which first one is informalization of the formal sector. This is true, and it is more pronounced among the women, and that is happening in Delhi. It's Delhi also. But what we consider, informalization of the formal sector, when we talk about those who are working in the informal sector and informal worker. Now informal worker have moved to formal sector as an informal worker. But in overall, it's an improvement in the quality when we consider those who are informal worker, but now they have moved to the formal sector or organized sector. So that is overall we consider as a movement towards the better quality of job. So that is happening in Delhi. The other one is women moving from the construction, or women declining in the construction sector. That is partially true, and I think we have also done a paper for recently for including all the NCR region. Actually, what is happening? Most of the construction work is happening in NCR region, and Delhi over the year, if you consider the recent years after 2010 or 11, 12, but in the earlier years, Delhi has a lot of construction, housing, and other things. But now the construction, most of the construction has shifted to NCR region. So most of the casual or construction worker now you will find in the overall, if you include it, so there is huge number of female engaged in construction work, but that is always, as I say, is in the NCR region. In Delhi, it's decline over the period. So the next one is, I think, female participation particularly the higher one, the higher educated one. So that's true. What you said, like those who are highly educated, they can afford to remain, they can afford and remain unemployed for the longer period because of either they belongs to the well-off families, or their families also support. But that is not in the case of those who are less educated and belongs to the poor families or poor income group. They have to work for their survival. So I think these are the things. And other one is like wage differential and education and other factors. So that I think I will see in details when I will finalize this paper. Thank you very much.
Thank you. And Swati Datta?
Yeah.
Would you like to speak?
Yeah. Thank you, panelists, for your detailed comments. So first of all, this paper is actually a large part of the larger project we have doing with Jimoluli ma'am, and it is basically the 3 parts. So one is based on the secondary data, based on the NSSO and the economic census data. One part is the aspiration of the students, and another part was the case study. So in my paper, so basically in terms of the definition of entrepreneurship, yes, it is not the self-employed or the low-paid entrepreneurs. We have followed the Schumpeter definition of entrepreneurs. So that is the dynamic aspects of the entrepreneurs who can take the risk-taking ability, and they have a creative destruction. So they enjoy when they create something. So in that way, definition is we are clear that we are not looking into the self-employed part of the own account workers, but broader terms of the entrepreneurship. And when in terms of the biasness, yes, there may be some kind of biasness, but still female and both male and female, they are aspired for the entrepreneurs, because instead when we are interacting with the students also, so they actually told they wanted to become entrepreneurs if they have a guide or something, if they know from where to start. Because now most of the institute have this incubation center where they get some kind of training, they get some kind of knowledge for pursue their entrepreneurship. So they at least develop some kind of product design where institute actually helping them to launch all those things. So that actually gives them exposure to develop their aspiration. In terms of sectors, in this questionnaire, we didn't ask directly any sector-wise aspiration of in which sector they wanted to go, because this was not part of this paper, but in the other part of our study where we look into the case study, where we have interviewed 10 to 20 successful entrepreneurs who have already in the startup stage, or they already have matured their entrepreneurship. So we have, and there we have seen women not only in the healthcare, but they have developed their own IT products for the child caring, even pet care, pet dog caring, or they have developed some kind of bamboo products. And they have developed their using their IT skill wherever they have studied. Maybe they studied IT skills, so they use those skills and try to develop some kind of products. And they have used their own occupational skill wherever they have gained some knowledge. So by using those skills, they have tried, and there they have discussed what types of problems they faced. So maybe that is different for the startup entrepreneurs, maybe, and that may be different for the who have already launched their products for the 10 years. But for every step, they have faced their problems. So that is part of our book, which will be coming soon. You can get details of those analyses, what are the women face those problems. I'm not going details. And in terms of this government program parts, yes, students actually lacking about those problems. So when we ask about these government programs, most of the case they don't know, or in sometimes they told there are so many programs, but how many programs are effective? In that is their major questions. So there may be lots of programs, but what is the success rate of the program? So students don't have much, expectation from those programs, because they don't see those kind of positive effect on those programs on them. Maybe they don't have direct effect of those programs. So that is the one biggest challenges. Maybe if the government and the students, there is some interaction between them, so that may be helpful to understand those government programs and from where they can get benefits. And in terms of this public-private family background of the students of the public-private is, I will look into this in my paper. Thank you.
Thank you. Thank you very much. I think we'll close the session here. And I really, really want to appreciate the presentations, which raise such interesting questions, and especially the panelists who brought all their experience to bear on the presentations and the questions you raised. And I'm sure that's going to be very helpful for the papers. Can I hand this back to Priyanka?
Thank you so much, ma'am. Yes. Thank you, Ms. Renana Jhabwala, for moderating this session. Thank you to all the panelists for contributing to the enriching deliberations, and of course, the paper presenters.
Priyanka, you're muted.
Yes. So thank you, ma'am. Thank you to our chairperson, Ms. Renana Jhabwala, for moderating this session. Thank you to all the panelists for taking time out and contributing to the deliberations of this session. And of course, to all the paper presenters for their presentations. I would like to now announce that we are going to take a break from 1:30 to 2:30 for lunch, and we will come back again. Please join with the same registration link for the second session, which is addressing constraints to women's work. Thank you so much, and thank you all. We will see you again at 2:30. Thank you.
Okay.
Thank you.
Thank you.
Thank you.
Thank you so much.